Cupping with scarification. You know that fancy wellness trend where celebrities post Instagram photos with big red circles on their backs? Yeah, that's cupping. What you probably don't know is that in ancient times, they took it to a whole new level, and it was way more intense than a few suction marks. Picture this. You're living in ancient Egypt, feeling sick, maybe feverish, tired, or just unlucky, and the local healer tells you your blood is stagnant and needs to be released. The solution? They grab a set of hollow animal horns or bamboo cups, heat them over a flame, and then press them onto your skin. The heat creates suction, pulling your skin upward like you're being grabbed by an invisible hand. And just when you think it's weird but tolerable, they take out a knife. This is where scarification comes in. The healer would make small cuts right where the cup was suctioned, and then put the cup back on. The negative pressure would draw blood out through those cuts, turning you into a human juice box. It wasn't just 1 or 2 cups either. Sometimes they'd cover your back, chest, or even your face. The idea was simple. Get the bad blood out, and your body will reset itself. Now let's be honest. This had to hurt. You've got hot cups sucking on your skin, tiny wounds being cut open, and blood being pulled out of you while everyone stands around saying this will make you feel better. And there was no anesthesia, of course. You just had to grit your teeth and hope your healer wasn't having an off day with the knife. Surprisingly, cupping with scarification wasn't just some fringe ritual. It was used in Egypt, Greece, China, and the Middle East for thousands of years. Even Hippocrates, yes, the do-no-harm guy, recommended it for treating everything from fever to menstrual problems. Basically, if you were sick, they thought the answer was to bleed you a little. So, did it work? Well, sometimes. Infections might have been drained, and the suction probably got blood flowing to sore areas, which can feel nice. But more often it just left people dizzy, weak, and covered in circular scars. And if the cups or knives weren't cleaned properly, which, spoiler alert, they weren't, you risk getting an even worse infection. Today, cupping is still around, but it's a lot gentler. Modern versions usually skip the cutting part, thankfully, and focus just on suction to relax muscles. Science is mixed on whether it really helps, but at least you won't be leaving your chiropractor's office missing a pint of blood. So next time you see those harmless little cup marks on an athlete's back, just remember a few thousand years ago that would have been a full-blown bloodletting session, and you would have been part of the cleanup crew.
Leech therapy for everything. You think going to the doctor today is uncomfortable? Imagine walking in with a fever in the Middle Ages, and the first thing they do is grab a bucket of live leeches. Not 1 or 2, sometimes hundreds. Yes, hundreds of wriggling, slimy, blood-sucking worms just waiting to turn you into their all-you-can-eat buffet. Here's how it worked. You'd be seated or laid out somewhere, probably already feeling miserable from whatever illness you had, fever, infection, even a headache. The doctor would bring out a container full of live leeches, pluck a few out with bare hands, and plop them right onto your skin. Usually they'd go for areas with good blood flow, your arms, your legs, your neck, even inside your mouth if they were feeling extra thorough. Within seconds, the leeches would attach, sink their teeth in, well, technically 3 tiny jaws with microscopic teeth, and start sucking. And here's the creepy part. They release an anesthetic in their saliva, so you wouldn't necessarily feel the bite right away, but you definitely feel the warm trickle as they started drinking. These little guys could each drain several teaspoons of blood, and when you had dozens of them working at once, you'd lose a shocking amount before the doctor decided you'd been balanced. Why would anyone do this? Back then, medicine was all about the 4 humors: blood, phlegm, black bile, and yellow bile. Too much blood was blamed for fevers, inflammation, and even bad moods. So obviously the solution was to get rid of some blood. Leeches were considered a safer, more controlled way to do that, compared to cutting you open with a blade. But here's the part they don't tell you in the spa brochures. Once the leeches were full, they'd just fall off, and you'd still be bleeding, sometimes for hours, because leech saliva contains a natural blood thinner. This meant people often needed bandages, or, in extreme cases, they just bled out more than intended. Records show that some very unlucky patients died from losing too much blood this way. And they didn't just use leeches for fevers. They used them for nosebleeds, yes, putting them in the nose, hemorrhoids, you can guess where that one goes, mental illness, skin diseases, and even to make someone paler if being too rosy was considered unhealthy. Today, leech therapy sounds like a medieval nightmare. But here's the twist. We actually still use leeches in modern medicine, in microsurgery and reattachment cases, because their saliva helps improve blood flow in delicate tissue. The difference is, now it's done in a sterile hospital, not a candlelit room with 50 leeches crawling all over you. So, next time you feel grossed out by a flu shot, just be glad you don't have to spend the afternoon as a leech buffet.
Venesection with animal horns. If you thought leeches were bad, wait until you hear about this one. Long before scalpels and syringes, doctors used cow horns. That's right. Actual hollowed-out animal horns, straight off a goat or cow, were considered top-tier medical equipment. Here's the setup. You're sick, maybe with a fever or infection, and your friendly neighborhood healer decides you've got bad blood that needs to come out. Forget fancy tools. They'd grab a sharpened blade, or sometimes just a really pointy piece of metal, and make a cut straight into one of your veins, usually in your arm or leg. That alone is terrifying enough, but we're just getting started. Next comes the horn. These weren't decorative. They were hollowed, polished, and sometimes fitted with a tiny piece of animal bladder or parchment as a primitive valve. The healer would press the horn to your open wound and literally suck at the other end, using their mouth or a little tube to create suction until the blood started flowing into the horn. Yes, you heard that right. They might actually put their mouth on the tube and start drawing your blood out by hand. If you're cringing, good, you're supposed to. Sanitation wasn't a thing. And this was done in everything from dusty desert tents to smoky village huts. The idea was simple.
drain just enough blood to balance your humors without killing you. Except they didn't always get that balance right. Take too much, and you'd faint or even die. Take too little, and they'd just keep cutting until they were satisfied that enough came out. Now, this wasn't just some backwoods superstition. Venesection with animal horns was standard practice across the Middle East, North Africa, and parts of Europe for centuries. Some even thought it had to be done seasonally, like a human oil change, to keep your body running smoothly. Pain factor? Off the charts. You've got an open vein, blood pouring into a horn, and a healer deciding when to stop based on how you look. No anesthetic, no sterilization, just a rag to bite on and maybe a prayer. And if you're wondering about infections, yes, they happened a lot. The horn might not be cleaned between uses, which means if the last patient had some nasty blood-borne disease, congratulations, you probably had it too by the end of the session. Did it work? Occasionally, yes. Draining blood can temporarily lower blood pressure, which might have made some patients feel lighter or less feverish. But in many cases, it just made them weaker. Today, obviously, we don't do this, except in very controlled settings for things like hemochromatosis, too much iron in the blood. And no, your nurse does not have to suck the tube to get things going. So, next time someone complains about giving a little vial of blood at the clinic, just remember it could be a lot worse. You could have had your veins tapped with a cow horn.
Bloodletting from the neck. If bloodletting from the arm sounds bad, wait until you hear about the version that went straight for the jugular, literally. Yes, in some parts of the ancient world, doctors believed the best way to balance your humors was by cutting open a vein in your neck. The idea came from an old medical belief that certain illnesses were caused by bad blood being stuck in the head or upper body. Fever, headaches, even mental disorders. The solution they sought was to get that blood out as close to the head as possible. And what's closer to the head than your jugular vein? Here's how it worked. You'd sit or kneel, and the physician, or barber surgeon if you were in medieval Europe, would tilt your head to one side, looking for that pulsing vein in your neck. Then they'd take a very sharp lancet or knife and make a precise slice, just enough to let the blood flow freely. No anesthesia, no numbing cream, just you, a blade, and a bucket to catch the blood. This wasn't a quick little prick either. They would let you bleed for as long as they thought was necessary, often until you started to look pale or dizzy. That was the sign they'd taken enough bad blood. If they took too much, well, fainting was common. Death was not unheard of. It was also risky because the jugular vein is a major blood vessel. Cut too deep and you could bleed out frighteningly fast. Cut in the wrong place and you could hit an artery instead, which is a recipe for disaster. Pain-wise, this had to be brutal. The neck is a sensitive area, and you'd feel every slice and every warm trickle as the blood poured out. Plus, it's not exactly easy to stay calm when someone's holding a blade that close to your throat. Imagine trying to sit still while that's happening, because jerking away could make things much, much worse. And let's talk hygiene, because there basically wasn't any.
The tools were often reused from one patient to the next without proper cleaning. Combine that with an open neck wound, and infections were almost guaranteed. So did this ever actually help anyone? In rare cases, yes, letting out a small amount of blood might reduce pressure in the head or help relieve certain vascular headaches. But most of the time, it just weakened the patient and made recovery harder. Today, doctors do sometimes access the jugular vein, but only in very controlled, sterile hospital environments, and usually to insert IV lines or draw blood when other veins can't be used. And they definitely aren't doing it to drain you until you pass out. So next time you think getting blood drawn from your arm is scary, just remember, at least nobody's coming at your neck with a blade and a bucket.
Bloodletting for mental illness. Feeling anxious? Depressed? Seeing things you can't explain? In the ancient and medieval world, the cure was often the same. Drain your blood until you calm down. That's right. One of the most common treatments for mental illness was to deliberately make you weaker by letting pints of blood flow out of your body. Here's how they justified it. Ancient medicine revolved around the four humors: blood, phlegm, black bile, and yellow bile. And they believed mental problems happened when those humors were out of balance. Too much blood in particular was blamed for excessive heat in the brain, which supposedly caused mania, hysteria, or delusions. So, of course, the solution was to take some of that blood out. The process wasn't subtle. You'd be restrained, sometimes gently, sometimes with leather straps if you were agitated, and the physician would make an incision in your arm, wrist, or even your ankle. Then they'd let you bleed into a bowl until you either calmed down or, more commonly, passed out. Passing out was seen as a good sign. It meant your excess had been drained. And we're not talking about a few drops here. Records show that patients could lose pints of blood in a single session. For someone already weak, malnourished, or distressed, this could push them dangerously close to death. But if they survived, doctors often claimed victory. After all, a sedated, pale, exhausted patient looks a lot calmer than an angry, shouting one. This practice was applied across the board, from melancholy, what we'd now call depression, to hysteria, a catch-all term for almost anything, especially in women, to seizures, even for madness caused by the moon. The thinking was that if you lightened the patient, you lightened their mind. Pain-wise, this could be terrifying. Not just physically, though yes, having your veins cut is painful, but emotionally. Many patients didn't understand what was happening to them, and being restrained and bled could feel more like punishment than treatment. And hygiene? Almost non-existent. Tools were reused without sterilization, so if the blood loss didn't get you, infection might. So did it ever work? Sometimes, but mostly by accident. Bloodletting can temporarily lower blood pressure, which may calm someone down. It also forces rest, since the patient becomes too weak to move. But in the long run, it rarely addressed the underlying mental condition. Today, mental health care has moved far, far away from knives and bowls. Modern psychiatry relies on therapy, medication, and support systems, not draining you like a car engine. Although, fun fact, there are still rare medical conditions where therapeutic phlebotomy, blood removal, is used, just not for mood swings or anxiety. So the next time you're stressed and someone says you need to blow off steam, be glad they don't mean grab the scalpel.
Hot iron cauterization. You know that phrase, adding insult to injury? Well, imagine getting injured and then having someone press a red-hot piece of metal directly onto your wound. Welcome to the ancient art of cauterization, where the cure was basically branding you like livestock. Here's the setup. You've got a deep cut, a tumor, or maybe you're bleeding after surgery. There are no antibiotics, no stitches, and no neat little bottles of rubbing alcohol. So what does the doctor do? They take a piece of iron, heat it in a fire until it's glowing red, and then, without warning, press it right onto your flesh. The idea behind cauterization was actually pretty smart for its time. Seal the wound, stop the bleeding, and maybe kill off whatever invisible poison was causing infection. In a world where infection could kill faster than the injury itself, this was one of the only ways they knew to stop the problem. But let's not sugarcoat it. This hurt like nothing else. We're talking searing heat, instant blistering, and the smell of your own flesh burning in real time. And you were awake for all of it, because anesthesia wouldn't become common until centuries later. Doctors used cauterization for all kinds of things: battlefield wounds, amputations, tumors, ulcers, and even hemorrhoids. Yes, that's right, hemorrhoids. Let that mental image sink in. In some cases, they believed it could burn out disease entirely, so they'd scorched not just the wound, but the surrounding area just to be safe. The experience was so intense that some patients had to be physically restrained to stop them from thrashing during the procedure. And if you were unlucky enough to have multiple wounds, they'd just keep reheating the iron and going back for round 2, 3, or 4. The good news is that sometimes it actually worked. It did stop bleeding, and it probably did kill some bacteria. The bad news is that it often left massive scars, could damage nerves and muscles, and sometimes made the infection worse if the burn wasn't kept clean afterward. Oh, and one more thing. This wasn't always done gently. In some cases, the doctor would jab the hot iron deep into the wound to cauterize from the inside out. Yes, that means what you think it means. You'd be branded on the inside. Today, cauterization is still used in medicine, but it's a far cry from the blacksmith-style torture of the past. Modern cautery tools are precise, sterile, and often done under anesthesia, so you don't feel a thing. So the next time you burn yourself cooking and whine about it, remember, in the old days, that was considered a legitimate treatment.
Nasal polyp burning. Got a stuffy nose? Be glad you live in the 21st century. Because a few centuries ago, if you had nasal polyps, those soft, swollen lumps that block your breathing, the treatment was not a gentle spray or quick outpatient surgery. Nope. The solution back then was to heat up a metal wire until it glowed and shove it straight up your nostrils. Let's set the scene. You're sitting in a dark, smoky room with a runny nose and constant sinus pressure, probably miserable because you can barely breathe. The physician comes in carrying a small brazier of hot coals and a thin piece of metal. They heat the wire until it's red hot, yes, glowing red, and then carefully insert it into your nose, aiming for the polyp. If you're thinking, wait, wouldn't that hurt? Oh yes, the burning wire instantly sears the inside of your nose, turning soft tissue into smoke and char. Patients were often restrained to keep them from jerking their head away mid-procedure because one wrong move could mean you end up with more than just your polyp burned. The smell alone must have been awful. Think about it. Burning flesh right under your own nose, filling your sinuses with smoke you couldn't even escape because your nose was blocked in the first place. Some historical accounts even mention using scented herbs or incense just to mask the odor so the doctor could keep working without gagging. The goal was to destroy the growth completely, and if one pass of the hot wire didn't do the trick, they'd heat it up again and go back in for another round. This wasn't a quick procedure. It could take multiple burns over multiple days to fully remove large polyps. Sometimes, instead of a straight wire, they used looped instruments, essentially a red-hot snare to cut and cauterize at the same time. And yes, bleeding was still common despite the burning, because the nasal passages are full of blood vessels. So, did it work? Surprisingly, sometimes yes. Burning the polyp could shrink or remove it, which meant you could breathe again, assuming you didn't pass out from pain or develop an infection afterward. But it wasn't exactly precise surgery, so patients often ended up with scarring inside their nose or damage to surrounding tissue. Today, nasal polyps are treated with sprays, steroids, or a quick, painless endoscopic procedure. No open flames required. Modern medicine also knows that polyps can come back, so there's a focus on treating the underlying inflammation, not just burning them away. So next time you're annoyed about using a nasal spray, just remember that in the past, the cure for a stuffy nose was literally to stick a red-hot poker up there and hope for the best.
Tongue cauterization. You think biting your tongue hurts? Try having someone deliberately burn it with hot metal on purpose because they think it will fix you. Welcome to the strange and terrifying world of tongue cauterization, a treatment once used for everything from speech problems to seizures. Here's the scene. You're a patient in ancient India, Greece, or the Middle Ages, and you have a stutter, epilepsy, or maybe just a rebellious tongue, a term doctors used for people who spoke too much or too angrily. Instead of speech therapy or medication, the healer's solution was simple. Burn part of the tongue to calm it down. The process went like this. The doctor or healer would heat a metal rod, usually an iron stylus or spoon, over a flame until it was glowing red. Then, with helpers restraining you so you didn't thrash, they'd hold your tongue out with a cloth or wooden clamp and press the hot metal right onto it. Instant, searing pain. Your tongue would blister, swell, and sometimes even fuse in places where the burn was deep enough. The patient often couldn't speak, eat, or drink properly for days. And believe it or not, that was considered a good sign. Silence meant the treatment was working. For epileptics, the belief was that the tongue was somehow involved in seizures, so burning it could interrupt the fits. In some cultures, this was done preventatively. Children with epilepsy were burned early, sometimes multiple times, to train the tongue and supposedly protect them from attacks. And yes,
Infections were common. The mouth is full of bacteria, and sticking a burn wound right in the middle of it is basically an invitation for trouble. Some patients died not from their original condition, but from sepsis caused by the cauterization. Was there any logic to this? Well, tongue cauterization might have stopped severe bleeding if someone bit their tongue badly during a seizure, so in a way, it could save a life in very specific situations. But for stuttering or speech problems, it just caused scarring and, in some cases, permanent damage that made speaking even harder. The pain factor here is almost unimaginable. Your tongue is one of the most sensitive parts of your body, full of nerve endings. Imagine trying to stay still while someone presses burning metal against it. And remember, there was no anesthesia, no numbing gel, no relief, just raw pain, the smell of burning flesh, and the knowledge that you'd still have to heal without antibiotics. Today, tongue cauterization is, thankfully, not a thing. Speech therapy, surgery for tongue tie, and modern epilepsy medication have taken its place. Doctors now focus on preserving function, not destroying it. So the next time you trip over your words in public and cringe, just remember, a few centuries ago, someone might have fixed that problem with a red-hot iron.
Branding for madness. If you think mental health stigma is bad today, just wait until you hear about this one. In some parts of the ancient and medieval world, one treatment for mental illness was to literally burn symbols onto a person's head with a hot iron. The idea? Scare or release the demons that were supposedly causing their madness. Let's set the stage. You're living in a time when mental illness isn't understood at all. There are no psychiatrists, no therapy, no medication. If you behaved strangely, talking to yourself, screaming in public, refusing to eat, people assumed you were possessed by evil spirits. And how do you get rid of a demon? Well, clearly you have to hurt it. So the village healer or priest would heat a branding iron until it glowed red. Sometimes it was a simple rod. Other times it was shaped into a cross, star, or other holy symbol. You'd be restrained, because who wouldn't fight back? And they'd press the iron to your scalp or forehead, burning the skin deeply. The pain would have been blinding, immediate, and inescapable. Your skull is rich with nerves and blood vessels, so the burn would have been agonizing and messy. Smoke would rise, hair would singe, and the smell of burning flesh would fill the room. Some records even say this was done in public, so the entire village could witness the evil spirit being punished. From their perspective, the patient's reaction, screaming, fainting, going limp, was seen as proof that the demon was leaving. In some cases, this process was repeated over and over until the patient either calmed down or simply became too weak to resist. And yes, there were scars. Big, obvious ones. Some historians think this may have been intentional, a way to mark someone as cured or as a warning to others that they were dangerous. Branding wasn't just medical, it was also social control. Did it work? Of course not. At least, not in the way they thought. It didn't remove demons, but the sheer trauma of the experience might have subdued the patient temporarily,
which probably convinced the healers that it had succeeded. More likely, it just left the person permanently scarred, physically and emotionally, and possibly with new infections or brain injury from the burns. Modern medicine takes a very different view. Today, branding someone's head would be considered torture, not treatment. Mental health care now focuses on therapy, medication, and humane support, not literally scalding the patient's skull.
Scalp cautery for migraines. Next time you complain about a migraine, just be glad you weren't born 1,000 years ago. Because back then, the cure for a pounding headache wasn't a dark room and some painkillers. It was setting your head on fire. Here's how it worked. Ancient and medieval healers believed migraines weren't just pain in the head. They were a sign of trapped heat or corrupted humors inside the skull. To fix that, they thought you had to release or balance that heat. And what better way to do that than with more heat? So, you'd sit on the ground or a wooden stool while the doctor prepared a small iron rod or metal instrument. They'd heat it in a brazier until it was glowing red, then press it directly to your scalp. Not just once, sometimes in multiple spots. The goal was to burn the skin deeply enough that blisters would form, because they believed the blisters would draw out the sickness. And yes, this meant your hair was burned off in the process. You'd leave the session with bald patches, blackened skin, and the unmistakable smell of charred hair and flesh. The pain must have been unbelievable. Migraines already make your head throb, and now you've got a hot poker sizzling into your scalp. The procedure could last several minutes, depending on how severe the healer thought your headache was. Some physicians even recommended doing this regularly as a form of preventative treatment. Imagine getting your head branded every few months just to keep future migraines away. Of course, this came with risks. Infection was common. An open burn wound on the scalp is basically a welcome mat for bacteria. Scarring was inevitable. Some patients even lost sections of skin or hair permanently, leaving them with patchy bald spots for life. The logic behind it wasn't completely random, though. Heat does increase blood flow, and sometimes increasing circulation to the scalp might have provided temporary relief. Plus, after a treatment this intense, the patient might have been too focused on the burn to notice their headache anymore. But more often, it just left them in worse shape. Now they had a migraine and second-degree burns. Today, we know migraines are caused by neurological and vascular changes, not trapped heat. Treatments now include medication, diet changes, and avoiding triggers, not scorching the top of your head until you smell like a campfire. So next time you reach for ibuprofen or shut the blinds to ride out a migraine, give a silent thanks to modern medicine. Your headache might be bad, but at least no one's coming toward you with a glowing hot iron rod and a confident smile. Early trepanation. Headaches, seizures, evil spirits, bad luck. In the ancient world, there was one extreme solution for all of them. Drill a hole in your skull. This practice, known as trepanation, is one of the oldest surgical procedures we've ever found evidence of. And yes, they really did it without anesthesia. Picture this. You've got blinding headaches, or maybe you've been behaving strangely after a head injury.
The local healer decides your skull is holding something inside, bad blood, pressure, or even an evil spirit, and that it needs to be let out. So they sit you down, maybe give you a strong drink or a herbal sedative if you're lucky, and bring out their tools. These weren't modern drills. In some cultures, they used sharp stones or flint scrapers. Later, metal tools were developed that could slowly twist or scrape a hole into the bone. The goal was to get through the skull, but stop before reaching the brain itself, which, amazingly, they often managed to do. The process could take a long time. The healer would scrape or drill layer by layer, exposing the dura, the protective layer around the brain, without puncturing it. If that sounds terrifying, it was. You'd feel pressure, hear the grinding of bone, and probably be held down by assistants to keep you from moving. And here's the wild part. People survived this. A lot of them. Archaeologists have found ancient skulls with perfectly round trepanation holes and signs of healing that showed the person lived months or even years afterward. In some cases, they had multiple holes, suggesting repeat procedures. Why would anyone go through this more than once? Well, if the first one seemed to help, maybe relieving pressure from a head injury or infection, they might have believed doing it again would prevent future problems. In some cultures, trepanation also had a spiritual purpose, letting out demons or allowing light to enter the mind. Of course, not everyone survived. Infection was a major risk, and without modern antiseptics, plenty of patients died from complications. But for its time, this was surprisingly advanced, an early form of neurosurgery, really. Pain-wise, brutal. The skull has no pain receptors, but the scalp does, and that had to be cut away first. Plus, the sound and vibration alone would be enough to make anyone panic. Today, trepanation is still done, but only in operating rooms by neurosurgeons with anesthesia, sterile tools, and imaging technology to make sure nothing goes wrong. It's used for things like relieving pressure after brain injuries or surgeries. So the next time you complain about an MRI being uncomfortable, remember, a few thousand years ago, the brain scan was just a hole drilled in your head.
Cataract couching. If the thought of putting in eye drops makes you flinch, buckle up, because ancient cataract surgery was on a completely different level. For thousands of years, the go-to treatment for cataracts, that cloudy lens that makes you go blind, was a procedure called couching. And it involved sticking a sharp needle directly into your eye. Here's the scene. You've been slowly going blind, your vision cloudy and dim. You find a healer, probably in India, Egypt, or later Rome, who claims they can fix it. There's no anesthesia, no numbing drops, and certainly no sterile operating room. You're seated in the open air or in a dimly lit house, and the healer asks you to hold perfectly still. Good luck with that. Then they take a sharp instrument, anything from a bronze needle to a fine thorn, and stab it through the white of your eye right near the edge of the cornea. The goal is to poke through just enough to reach the cataract, which is actually the clouded lens of your eye. And here's the horrifying part. Once the needle is inside, they start pushing. The idea was to shove the cloudy lens out of the way, literally dislodging it so it would sink down to the bottom of the eye. This would let light back in so you could see again, at least a little. If you're wincing, you should be. No numbing meant you felt every bit of that pressure and pain. Plus, you'd be wide awake, watching a needle move inside your own eye. If you moved too much, there was a very real chance they could rupture the eye entirely, leaving you permanently blind or even at risk of infection that could kill you. But when it worked, it must have felt like a miracle. Patients who'd been blind for years could suddenly see shapes and light again, not perfectly, but enough to function. The problem? Without the lens, the world would be a blurry mess, and you'd need extremely thick lenses, something they didn't have back then, to bring things into focus. Complications were common: infection, total blindness, or just the cataract coming back when the dislodged lens floated back into place. Sometimes healers tried the procedure multiple times, which, yes, meant multiple stabs to the eye. Today, cataract surgery is one of the safest and most common operations in the world. Instead of pushing the lens aside, surgeons now remove it completely and replace it with an artificial lens, restoring near-perfect vision, all with numbing drops and a quick outpatient procedure. So, next time you dread going to the eye doctor, just remember, at least they're not coming toward you with a needle and the plan to just poke it until you see better.
Hemorrhoid surgery. A man lies on a wooden bench, gripping the edges so tightly his knuckles turn white. 2 assistants hold his legs apart. The room smells of smoke and sweat. The surgeon leans over, scalpel in one hand, a glowing piece of iron in the other. There's no anesthesia, no privacy, just a procedure that is about to make sitting down a nightmare for weeks. This was hemorrhoid surgery in the ancient world. Hemorrhoids, those swollen, painful veins around the rectum, were considered serious enough to warrant cutting them off entirely. Ancient medical texts, including those of Hippocrates, describe the process step by step. Pull the hemorrhoid out, slice it off, and cauterize the wound with heat to stop bleeding. First, the patient would be positioned so the surgeon had a clear view, often lying on the side or even bent forward over a table. There was no numbing cream, no sedative beyond maybe a drink of wine, and no soft words of reassurance. The surgeon would grab the swollen tissue with forceps or cloth, stretch it tight, and slice through it with a sharp blade. And then came the worst part, cauterization. The surgeon would press a red-hot iron directly to the wound to seal it shut. This wasn't just to stop bleeding, it was also meant to burn out any disease or bad humors lingering in the area. You can imagine the pain. This is one of the most sensitive areas of the body, and the smell of burning flesh would have been overwhelming. Patients screamed, fainted, or had to be restrained so they didn't move mid-procedure. Infections were common, since keeping a wound clean in that area was next to impossible before modern sanitation. Recovery was slow and miserable, with patients often unable to walk or sit for days. And because hemorrhoids can come back, some unlucky souls had to endure the process more than once in their lifetime. As brutal as it sounds, there was a logic to it. Cutting and cauterizing really could remove the swollen vein and stop dangerous bleeding. In fact, it was one of the few surgical procedures that sometimes actually worked, if the patient survived the pain and avoided infection. Today, hemorrhoid surgery is still performed, but it's done in a sterile operating room with anesthesia, precision instruments, and proper aftercare. Recovery is faster, safer, and far less traumatic.
So next time someone grumbles about a quick outpatient hemorrhoid procedure, remember the old version. No painkillers, no sterile gloves, just a scalpel, a glowing iron, and the hope that you'd still be able to sit down afterward.
Fistula knives. What do you do when a king has a medical problem that nobody wants to talk about? You invent a whole new surgery for it. That's exactly what happened when French King Louis XIV developed a rectal fistula, an abnormal tunnel that forms between the rectum and the skin. Painful, messy, and embarrassing, this royal problem gave rise to one of the most infamous surgical tools in history, the fistula knife. A fistula, if you've never heard of it, is essentially a little tunnel caused by infection. It leaks, it hurts, and in Louis's case, it was making it impossible for him to sit comfortably on the throne, literally. With the most powerful man in France unable to do his royal duties without squirming in agony, his surgeons were under pressure to find a cure. The solution? A custom set of knives and probes designed specifically for cutting open and draining the fistula. The procedure was simple in theory, but horrifying in practice. The surgeon would insert a thin steel rod through the fistula tract, yes, straight through the tunnel, until it came out the other side. Then, using the rod as a guide, they'd slice the tissue open from end to end, turning the hidden tunnel into an open wound. To keep it from closing up too soon, they sometimes tied a cord through the fistula, like threading a bead, and left it there. The cord would be tightened over time, gradually slicing through tissue until the fistula was fully opened and could heal from the inside out. Imagine sitting down with a piece of string looped through your backside, cutting a little deeper every day. Pain? Off the charts. Even with opium or wine as a sedative, patients were awake, fully aware, and feeling every slice. And infection was always a looming threat, since the surgery was performed in the dirtiest part of the body. But in Louis XIV's case, it worked. He survived, healed, and was so grateful that fistula surgery suddenly became fashionable among nobles. Yes, people voluntarily underwent similar procedures just to imitate their king, even if they didn't need it. The procedure itself remained a surgical staple for centuries. Surgeons kept refining the tools, long, slender knives with curved tips, special probes, and cutting cords known as setons. It was brutal, but in a time before antibiotics, it was one of the only ways to prevent a fistula from turning into a fatal infection. Today, fistula surgery still exists, but it's far kinder. Patients are put under anesthesia, surgeons use precise instruments, and the risk of infection is carefully managed. No one is threading cords through you and tightening them day after day like some medieval torture device. So the next time you complain about waiting at the doctor's office, be glad you're not living in the 17th century. Because back then, the cure for a royal pain in the butt was exactly that, a knife in the backside. Breast cancer surgery. The room is silent, except for the crackle of firelight. A woman sits upright on a wooden chair, clutching the sides as two assistants hold her still. Across from her, the surgeon sharpens a long curved knife. There will be no anesthetic, no numbing, no escape. In a few moments, her breast will be cut away, and her only hope is to survive the pain long enough to heal. Before modern medicine,
breast cancer was a death sentence unless it could be cut out entirely. Physicians knew tumors spread, and the only chance to save a life was to remove all the tissue around the lump, including the entire breast if necessary. This wasn't a quick or gentle procedure. It was a desperate one. Here's how it went. Once the patient was secured, the surgeon would slice through skin, muscle, and connective tissue as quickly as possible. There was no sterile field, just whatever table or bench was available. Blood would pour freely, and the assistants often had to hold bowls beneath the wound to keep it from flooding the floor. The surgeon's goal was speed. The faster they worked, the better the chance the patient wouldn't go into shock. In some cases, the surgeon also cut into the chest wall to remove as much tissue as possible, believing this would stop the cancer from spreading. Once the breast was removed, there was still the problem of bleeding. In the best-case scenario, the surgeon would cauterize the wound with a red-hot iron to seal blood vessels. This added a second layer of agony, but without it, the patient might bleed to death on the spot. And then came the waiting game. Infection was common, and pain management was almost non-existent. Some women survived, healed, and lived for years cancer-free, proving the surgery sometimes worked. But many others died in the days or weeks afterward from sepsis or blood loss. This procedure was so intense that surgeons actually considered it one of the most challenging operations of their time. Some even became famous for their ability to do it quickly and skillfully, like celebrity doctors of the 18th and 19th centuries. It's worth remembering that these women were often incredibly brave, facing a terrifying procedure fully conscious, with no guarantee of survival. Some accounts say they sang hymns or recited prayers to keep calm, while others fainted and had the surgery completed while unconscious. Today, breast cancer treatment is vastly different. Surgeons can perform lumpectomies or mastectomies under anesthesia, with precision tools, sterile rooms, and follow-up care that dramatically increases survival rates. So when we talk about fighting cancer, it's worth remembering the women who literally sat through it being carved out of them, awake, in agony, and hoping it would give them a second chance at life.
Bladder stone surgery. The patient lies flat on a rough wooden table, knees pulled up to his chest. Two men pin his arms and legs in place. The surgeon kneels between his legs, holding a curved knife. There's no anesthesia, no clean instruments, just a room full of people waiting to see if this man will live through one of the most feared procedures of the ancient world, bladder stone surgery. Bladder stones, hard, painful mineral deposits, were a common problem in the past, especially when diets were heavy in grains and water quality was poor. They caused constant pain, blood in the urine, and sometimes complete blockage. If the stone was too large to pass naturally, there was only one option: cut it out by hand. This operation was known as lithotomy, and it was one of the most dreaded surgeries ever performed. The process started with the patient being held down or strapped in place. The surgeon would locate the stone by pressing on the lower abdomen, then make an incision through the perineum, the very sensitive area between the scrotum and the anus in men, or between the vagina and anus in women. Once the cut was made, the surgeon would insert a finger or a metal probe into the bladder to feel for the stone. Then came the moment everyone was waiting for, reaching in and pulling the stone out. Sometimes the stone was small enough to remove whole. Other times it had to be crushed inside the bladder and pulled out in pieces. The agony must have been excruciating. There are records of patients screaming, fainting, or having to be gagged so they wouldn't bite their tongue. Some died on the table from shock or blood loss before the stone was even removed. But if you survived, the relief could be life-changing. Imagine living with a constant stabbing pain every time you urinated, then suddenly gone. That moment of triumph might have been the only thing that made the agony worth it. Lithotomy was so specialized that entire guilds of surgeons were devoted to it. These stone cutters traveled from town to town performing the procedure, often in front of an audience. Some became famous for their speed, which was crucial. The faster the operation, the better the patient's chance of surviving. Even so, infection was common, and some patients were left with lifelong incontinence or other complications. But many lived for years afterward, pain-free for the first time in ages. Today, bladder stones are treated with ultrasound, lasers, and minimally invasive surgery. No crude knives, no public spectacle, and no need to hold anyone down.
Rib removal. In the days before antibiotics, a lung infection could be a death sentence. Pneumonia, abscesses, and tuberculosis slowly suffocated patients, and doctors were desperate to find any way to drain the infection. Their solution? Open the chest by cutting through the ribs, one of the earliest and most terrifying forms of thoracic surgery. Imagine lying on a wooden table, gasping for air, each breath rattling painfully. The surgeon explains that your lung is full of corruption that must be released. There are no ventilators, no sterile gloves, no anesthesia beyond perhaps a gulp of wine or an herbal draught. What follows will be agony, but the only alternative is certain death. The procedure began with a large incision across the chest or side. Using knives, saws, or chisels, the surgeon would cut away sections of one or more ribs to create an opening into the chest cavity. Assistants held the patient down as the tools bit into bone, the sound and vibration impossible to ignore. The pain would have been overwhelming, and many patients fainted before the rib was fully removed. Once the rib sections were taken out, the surgeon gained access to the infected lung. If pus had collected around it, they would drain it by hand or with crude suction devices, sometimes even inserting cloths or sponges into the cavity to soak up the infection. The idea was to let the diseased fluid escape and give the patient's body a chance to recover. Survival was far from guaranteed. Many patients died on the table from shock or blood loss. Others succumbed days later to infection, since the chest cavity was now exposed to the outside world. But for those who lived, the procedure could sometimes save a life, draining a massive abscess that otherwise would have crushed the lung completely. Rib removal was not a common surgery, but it became a last resort when all other remedies failed. Ancient and medieval physicians recorded cases of patients surviving for months or even years after the operation,
though usually with chronic pain or breathing difficulties. From the surgeon's perspective, these operations were feats of bravery, both for the doctor and the patient. Cutting into the chest was seen as entering the very seat of life, and it was done only when there was no other choice. Today, thoracic surgery still involves removing or spreading ribs to reach the lungs, but it's done under general anesthesia, with precise tools, sterile environments, and advanced aftercare. Patients can recover fully and go on to live long, healthy lives, something almost unimaginable in the ancient world. So the next time you take a deep breath without thinking, remember, people once risked excruciating surgery and the loss of their ribs just to keep breathing at all.
Extreme emetics. What's the worst thing you've ever taken for an upset stomach? Some chalky pink liquid, maybe? A bitter herbal tea? Now imagine being given a poisonous plant strong enough to make you vomit for hours because your doctor thought the more you puked, the healthier you'd be. Welcome to the world of ancient emetics. For centuries, physicians believed that sickness was caused by bad humors or corrupted matter trapped inside the body. And if your body refused to get rid of it naturally, they'd force it out. Enter hellebore, a plant so toxic that it was once used as rat poison, but also prized in ancient Greece and Rome as a medical cure-all. The process was as brutal as it sounds. A patient would be given a concoction brewed from hellebore root or other powerful herbs. Within minutes, the body reacted violently. The patient would double over, retching uncontrollably, sometimes for hours. The goal wasn't just one round of vomiting. It was to keep going until the doctor decided you'd expelled enough badness from your stomach. And it wasn't just hellebore. Other plants like ipecac, black hellebore, and even poisonous metals like antimony were used to trigger relentless vomiting. The more violent the reaction, the more convinced the healer was that the treatment was working. Patients described the experience as pure misery, waves of nausea, stomach cramps, weakness, and sometimes fainting. In high doses, the treatment could cause seizures, dehydration, or even death. Yet somehow it remained popular for centuries, prescribed for everything from fevers and indigestion to mental illness and excess melancholy. It wasn't only about the stomach either. Some doctors used emetics as a sort of spiritual cleansing, the idea that purging the body would also purge the soul. Patients might be encouraged to vomit as part of rituals or seasonal detoxes, leaving them pale, trembling, and supposedly purified. Of course, some people did feel better afterward, not because of humors, but because vomiting can relieve certain kinds of food poisoning or indigestion. But far more often, patients were left weaker than before, their bodies drained of fluids and strength. And yet, the reputation of emetics lingered well into the 18th and 19th centuries. Even then, parents sometimes forced children to drink ipecac syrup if they swallowed something bad. Only much later did medicine begin to recognize that induced vomiting often does more harm than good. Today, doctors strongly discourage using emetics, except in very rare controlled cases.
Modern medicine has safer, more targeted treatments for poisoning or digestive issues, none of which involve hours of violent retching. So next time you sip ginger tea for nausea, be grateful you're not stuck in ancient Greece with a cup of hellebore waiting to turn your entire afternoon into a purge you'd never forget.
Purgative enemas.
Few medical treatments have been the butt of more jokes, literally, than the enema. But in the ancient world, this wasn't just about constipation. It was a full-on medical ritual meant to cleanse your entire body of corrupted humors. And the recipe wasn't just warm water. Oh no, they got creative. Ancient Egyptian papyri described elaborate enema recipes, calling for ingredients like honey, wine, salt, and various herbs. In India's Ayurveda, medicated enemas were considered one of the 5 great cleansing therapies. And in medieval Europe, they sometimes went even further, using broth, smoke, or even hot oil as the cleansing fluid. Here's how it worked. You'd be positioned on your side or knees, and a long tube, sometimes made of animal horn or leather, would be inserted into the rectum. Then, with the help of a bladder or pump, the liquid would be forced inside. Depending on the mixture, it could be hot, cold, or burning with spices and herbs. The goal wasn't comfort. The idea was to flush out bad humors as completely as possible. Patients were often told to hold the liquid in as long as they could, sometimes walking around or being shaken to dislodge the sickness before releasing it. The result could be violent diarrhea, cramping, and dehydration, which was taken as a sign the treatment was working. In some cultures, this became almost a wellness routine. Ancient Egyptians reportedly used enemas regularly, believing they prevented disease. French royal courts even turned it into a bizarre luxury. King Louis XIV was said to have received hundreds of enemas over his lifetime, some performed while he entertained guests. But not all enemas were gentle. Historical texts describe ones mixed with vinegar, garlic, or even powdered metals like antimony, substances that could irritate the intestines or even poison the patient. Hot water enemas could burn delicate tissue, causing bleeding or long-term damage. Despite the risk, many patients swore by them. After all, the treatment left you empty, lightheaded, and sometimes euphoric, mostly because your body was in shock from losing so many fluids at once. Today, enemas still exist, but they're mostly used for specific medical purposes, like clearing the bowel before surgery, and are made with safe, sterile solutions. The idea of using them as an all-purpose cure for everything from headaches to fevers has, thankfully, gone out of fashion. So the next time someone talks about detoxing, just remember, a few hundred years ago, that meant lying on your side while someone pumped a cocktail of herbs and hot water where the sun doesn't shine and calling it good medicine.
Toxic laxative metals. Mercury, the same metal in old thermometers, was once swallowed on purpose as a laxative. Yes, really. For centuries, doctors prescribed poisonous metals like mercury and antimony to clear out the bowels, believing that violent diarrhea was the key to restoring health. This practice came from the ancient idea that disease was caused by something bad lingering in the body: spoiled food,
corrupted humors, or even moral impurity. If you could flush everything out quickly enough, you could reset the system. And nothing flushed the system faster than these toxic heavy metals. Mercury was sometimes taken as calomel, a chalky white powder that acted as a powerful purgative. Patients would swallow a dose and then spend the next several hours, sometimes days, doubled over with stomach cramps, diarrhea, and vomiting. Antimony was used in similar ways, often in pill form, and was so effective that it earned the nickname the perpetual pill, because some wealthy families would literally reuse the same antimony pill over and over, retrieving it after it passed through the body. The experience was miserable. The purging was violent and uncontrollable, leaving patients dehydrated, weak, and sometimes delirious. And because these were heavy metals, they didn't just pass through harmlessly. They were absorbed into the body, slowly poisoning the patient over time. Chronic users suffered from tremors, tooth loss, and organ damage. But to doctors of the time, this was a sign the medicine was working. If you were sweating, shaking, and running to the chamber pot all day, it meant the bad stuff was being expelled. Some physicians even used these treatments preventively, recommending regular doses to keep the body pure. Unsurprisingly, deaths occurred. Overdosing on mercury or antimony could cause fatal kidney or heart failure. But these substances remained popular well into the 18th and 19th centuries, especially during epidemics. During yellow fever outbreaks, for example, patients were sometimes given massive doses of calomel to purge the infection, a treatment that likely killed as many people as the disease itself. It wasn't until much later that doctors realized the danger of heavy metal poisoning. Modern medicine abandoned mercury and antimony laxatives in favor of gentler, safer methods of treating constipation or poisoning. Today, you can still see the legacy of these old treatments in how we think about detoxing. The idea that you have to purge your system to be healthy is thousands of years old. But thankfully, we no longer do it with substances that slowly kill you from the inside out. So the next time you see cleanse tea at the store, be glad the ingredient list doesn't include mercury powder.
Forced sweating. What would you do if your doctor told you to sweat until you nearly passed out? In the ancient world, that wasn't a metaphor. It was an actual prescription. For centuries, healers believed that sweating was the ultimate way to purge disease, and they were willing to push patients to the brink of collapse to make it happen. Sweating was thought to be nature's way of expelling poison from the body. If you had a fever, infection, or even joint pain, the solution was to make you sweat more, sometimes a lot more. This practice wasn't limited to one culture. The Greeks, Romans, Chinese, and many indigenous peoples around the world all used sweat-based therapies, though not always this aggressively. The ancient version of sweat therapy could be intense. Patients were locked in small sealed rooms or sweat lodges where hot stones, coals, or steam heated the air until it was almost unbearable. Some were wrapped in thick blankets or furs to trap body heat, or made to drink hot herbal teas to force even more perspiration. The goal was to keep sweating until the doctor decided you'd reached the right level of purification. That often meant hours of suffering in oppressive heat, drenched in sweat, dizzy and weak. If you fainted, that was sometimes considered proof that the treatment had worked. Your body had expelled whatever was wrong with you. In Europe, this was sometimes taken to extremes during epidemics. People with the plague were shut in heated rooms to sweat out the illness, which not only failed to work, but also likely accelerated their deaths. In other cases, sweating was used as a test of vitality. If you could endure the session and survive, you were declared cured. To be fair, sweating does have some benefits. It opens pores, increases circulation, and can help the body fight mild infections. But forced sweating for hours can cause dangerous dehydration, overheating, and even organ failure. Some patients likely did feel better afterward, but mostly because they were exhausted and sedated by the experience. Others emerged so weak they couldn't walk, and those who didn't make it out at all were sometimes quietly chalked up as too sick to save. Today, controlled heat therapy still exists. Think saunas, steam rooms, or fever therapy in certain medical settings. But it's gone in a much safer, measured way. There are limits on time and temperature, and hydration is encouraged to prevent collapse. So the next time you enjoy a nice, relaxing sauna session, remember your ancient counterpart might have been locked inside until they nearly passed out, all in the name of good health.
Blister beetle therapy. There's an insect whose defensive chemical is so toxic it can raise giant blisters on your skin. And for centuries, people deliberately smeared that chemical on their bodies, on purpose, because they thought the blisters would heal them. Meet the blister beetle. When crushed, it releases cantheradin, a potent irritant that causes the skin to bubble up in painful blisters. Ancient physicians turned this into medicine by making a paste from dried, ground beetles and applying it to patients' skin. The goal? To draw out sickness from deep inside the body. Here's how a session might go. If you had a fever, arthritis, or some mysterious internal illness, the doctor would choose a spot on your skin, usually somewhere easy to access, like your back, chest, or arms, and spread the beetle paste on it. Within a few hours, the area would start to redden and bubble up. The patient might feel burning, itching, or stabbing pain as the blister grew larger and larger. The bigger the blister, the more successful the treatment was considered. Once the blister was fully raised, it might be deliberately popped and drained, leaving a raw, weeping sore. Sometimes fresh paste was applied again to keep the blister from closing too quickly. This could go on for days, turning a single small spot into a patchwork of open wounds. Why go through all this? The belief was that the blister acted as a kind of trap for disease, pulling bad humors or toxins out through the skin. Blistering was used to treat everything from fevers and lung infections to gout and even paralysis. But it was far from harmless. Cantheradin isn't just a blistering agent, it's poisonous. Absorbed through the skin, it could cause vomiting, kidney damage, or even death in high doses.
Patients sometimes suffered secondary infections from the open sores or were left with permanent scars. Despite the danger, blister beetle therapy became wildly popular, especially in the 18th and 19th centuries. Apothecaries sold Spanish fly preparations as a standard remedy, and doctors prescribed them liberally. Some people even used cantharidin as a stimulant or aphrodisiac, an extremely risky choice that led to more than a few accidental poisonings. Today, cantharidin is still used, but in a very controlled way. Dermatologists sometimes apply it to remove warts or molluscum, carefully measuring the dose to prevent serious burns. It's applied by professionals, not rubbed on at home with a mortar and pestle. So the next time you get annoyed by a tiny blister from new shoes, imagine someone grinding up bugs just to raise one on purpose and calling it medicine.
Tooth extraction with pliers. The patient is seated on a rough wooden stool, mouth forced open, sweating as the barber surgeon leans over with a pair of iron pliers. There's no numbing shot, no gentle dentist telling you to open wide. The tooth is coming out, and you're going to feel every single second of it. In the ancient and medieval world, tooth pain was a nightmare. Cavities, abscesses, and infections could be so severe they swelled the jaw and caused fevers. The only solution? Get rid of the offending tooth. But dentistry, as we know it, didn't exist yet. So extractions were crude, fast, and brutal. The tool of choice was the dental key or iron forceps, heavy, simple pliers with no padding. The patient might be given a piece of leather to bite, or a strong drink to dull the fear, but nothing could dull the pain. The surgeon would clamp the pliers around the tooth and twist hard. If the tooth came out cleanly, the procedure was over in seconds. If not, things got ugly. Teeth could break off mid-extraction, leaving fragments jammed in the gums. Sometimes the force shattered part of the jawbone or tore away gum tissue. There are accounts of entire sections of teeth being removed at once when the tool slipped. Bleeding was heavy, and infection was common. Without antiseptics, even a successful extraction could lead to swelling, fever, or worse. In some cases, the infection that caused the toothache in the first place spread deeper into the jaw or bloodstream, something we now know can be deadly. But for all its horror, the procedure often brought instant relief from pain that might have been unbearable for weeks. A patient could go from sleepless agony to, at least temporarily, pain-free in a matter of minutes. Tooth extraction was so feared that it was often done as a last resort, but it was still one of the most common medical procedures of the era. Traveling tooth drawers set up in markets, pulling teeth for a small fee, sometimes as public entertainment. People would gather to watch unlucky patients scream as their bad tooth was yanked out. Today, dentistry is a completely different experience. Extractions are done under local anesthesia, with sterile tools, suction, and pain management afterward. Broken teeth can often be repaired or crowned instead of ripped out entirely. So the next time you sit back in a modern dental chair, take a moment to appreciate the bright lights, the numbing gel, and the soft music.
because a few centuries ago, your only options were pliers, brute strength, and the hope that you didn't end up with a broken jaw as a bonus souvenir.
Nerve cautery for toothache. How desperate would you have to be to let someone shove a red-hot wire into your tooth? For people in the ancient world, the answer was simple, desperate enough to try anything to stop the pain of a toothache. Tooth pain was one of the most common complaints in history. Without toothbrushes, fluoride, or fillings, cavities and abscesses were practically guaranteed. The constant throbbing could drive people mad, and when the pain got unbearable, some healers turned to a brutal method, cauterizing the nerve inside the tooth. Here's how it worked. The healer would heat a thin metal rod until it glowed. Then, holding the patient's mouth open, sometimes by force, they'd jam the tip of the rod into the decayed tooth. The goal was to burn the exposed nerve at the center, killing it so the pain would stop. The agony must have been indescribable. The tooth pulp is one of the most sensitive parts of the human body, packed with nerves. Imagine a lightning bolt of pain shooting straight through your jaw and skull, and knowing you had to stay still because jerking away mid-procedure could mean even worse damage. And the smell? Burning enamel and tissue inside your own mouth. Patients sometimes fainted from the shock, which the healer probably welcomed since it made the job easier. The theory wasn't completely wrong. Destroying the nerve could stop the pain temporarily, and in some lucky cases it worked. But more often, the procedure just left a charred, infected mess. If bacteria were already in the tooth, burning it only made things worse. Patients could end up with swollen faces, spreading infections, or even death from sepsis. Despite the risks, this practice lingered for centuries. Some medieval texts even recommended mixing cautery with herbal poultices. Burn the tooth, then smear garlic or vinegar on the wound to draw out the poison. That probably didn't help much, but it shows how determined people were to find relief. Compared to extraction, nerve cautery was sometimes considered the gentler option, since it left the tooth in place. But most of the time, the pain returned anyway, and the patient ended up losing the tooth later. Today, we've perfected what those early healers were trying to do. Modern root canals carefully remove the infected pulp, tween the inside of the tooth, and seal it to prevent reinfection. And thanks to anesthesia, patients feel nothing during the process. So next time you hear someone complain about a root canal, remind them of the old alternative, lying back while a glowing hot wire was shoved into their tooth with no numbing, no sterilization, and no guarantee that you wouldn't be right back in the chair next month. Jaw drilling for abscesses. There was a time when the cure for a swollen jaw was literally to drill a hole in it. Jaw abscesses, deep infections caused by untreated tooth decay or injury, were common in the ancient world, and they could be excruciating. The pain radiated through the entire face, making it hard to eat, sleep, or even think. Left untreated, the infection could spread and kill the patient.
So doctors developed a terrifying but sometimes life-saving solution. Bore a hole straight through the bone to let the infection drain. The procedure was brutal. The patient would be restrained or held still by several assistants. There was no anesthesia beyond a gulp of strong wine, and no sterile instruments. The surgeon would first locate the swelling along the jaw and mark the spot. Then came the tool, a primitive trephine, essentially a hand-powered drill designed for bone. The surgeon would press the trephine against the jawbone and begin turning it, slowly grinding away layer after layer of bone. The sound and vibration would have been horrifying, echoing through the patient's skull. The pain, nearly unimaginable. The jaw is packed with nerves. Some patients fainted before the procedure was finished, which may have been the closest thing they had to pain relief. Once the drill broke through, pus would drain out, often in large quantities. This might have been both disgusting and strangely relieving. The pressure and pain would decrease almost immediately. The wound would then be packed with cloth, herbs, or other materials to keep it open so more infection could drain over the next few days. But success came with risks. An unclean drill meant more bacteria entering the wound. If the infection had already spread too far, drilling might not save the patient at all. And even if they survived, they could be left with permanent scarring or damage to the jawbone. Still, this method sometimes worked. Relieving the pressure could stop the infection from spreading and give the immune system a fighting chance. In an era with no antibiotics, this was as close to a miracle as you could get. Today, jaw infections are treated with antibiotics, drainage under sterile conditions, and, if necessary, modern surgical tools that can precisely open and clean the infected area. Patients are numbed or sedated so they don't feel a thing, and recovery is usually quick and safe. So, the next time you get a toothache and think you're suffering, be grateful you won't hear the whir of a hand drill as someone gets ready to carve a hole in your jaw just to save your life.
Tongue piercing for speech issues. Would you let someone stab your tongue with a sharp instrument if it promised to cure your stutter? In the ancient world, plenty of people did, because for centuries, tongue piercing was considered a legitimate medical treatment for speech problems. Speech disorders were poorly understood in early medicine. Stammering, lisping, or slurred speech were often blamed on a lazy tongue, or on the tongue being too long, too thick, or tied too tightly to the bottom of the mouth. Healers believed that by cutting or piercing the tongue, they could reshape it, or at least loosen it, so words would come out properly. The procedure varied depending on the culture. Sometimes it was as simple as stabbing the tongue with a sharp needle or awl. Other times, a heated wire was used to pierce it, cauterizing the wound at the same time. In more extreme versions, the underside of the tongue, the frenulum, was sliced entirely, a procedure that still exists today in a much safer form, known as a frenectomy. The patient experience was horrifying. You'd have to hold your tongue out while someone approached you with a knife, hook, or hot needle. Pain would be immediate and intense, and the wound could bleed heavily. In the worst cases, the entire tongue could swell so much afterward that the patient struggled to breathe or swallow for days. And the treatment wasn't always a one-time thing. Some patients had their tongues pierced or cut repeatedly in the hope of better results. Others were told to stretch or massage the wound daily while it healed, a process that was both painful and risky in an era without antiseptics. Did it work? Occasionally, yes, if the patient had ankyloglossia, tongue tie. Cutting the frenulum might have improved their speech. But for most stammering or speech problems, piercing the tongue did nothing except cause pain, scarring, and sometimes permanent damage. There were also cultural and superstitious reasons for tongue piercing. In some regions, it was seen as a way to punish or discipline a disobedient tongue, not just for stammering, but for swearing, gossiping, or lying. This blurred the line between medical treatment and public humiliation. Today, tongue piercing is mostly a form of body modification and self-expression, done safely with sterilized equipment and aftercare. Speech disorders are treated with therapy, surgery when needed, and sometimes medication, not with crude stabs in a marketplace. So the next time you trip over your words or stutter in public, take comfort in knowing that no one is about to grab a red-hot wire and spear your tongue in the name of fixing you.
Mouth fumigation. Modern medicine gives you numbing gels, antiseptic rinses, and minty mouthwash. Ancient medicine? It gave you a faceful of smoke. Mouth fumigation, literally blowing herbal smoke into someone's open mouth, was once considered cutting-edge treatment for dental pain, gum disease, and even bad breath. The idea came from a simple observation. Certain herbs seem to purify the air or repel disease. So, why not use them to cleanse the mouth, the gateway to the body? Physicians across ancient Egypt, Greece, India, and medieval Europe all had recipes for fumigation mixtures, often made of frankincense, myrrh, garlic, sage, or even animal dung in some cases. Here's how a session might go. The patient would sit with their mouth wide open while the healer burned herbs or resins on hot coals. Then, using a funnel, hollow reed, or even just their breath, the smoke would be directed straight into the mouth and throat. The sensation would have been intense, hot, acrid smoke hitting the tongue and palate, stinging the eyes and forcing a patient to cough. The healer might ask the patient to hold the smoke in as long as possible, believing it would penetrate the diseased areas and kill whatever was causing pain or infection. Mouth fumigation wasn't just for toothaches. It was also prescribed for sore throats, tonsil infections, and even internal illnesses like stomach problems, on the theory that the smoke would travel deeper into the body and purge bad humors. And yes, it hurt. The smoke could scorch the mouth, dry out the tongue, and sometimes leave burns on the lips if the funnel was too hot. Prolonged fumigation sessions could even cause blistering or make existing ulcers worse. But if the patient felt a sudden relief, even if it was just numbness from the irritation, the treatment was considered a success. Sometimes fumigation was combined with cautery.
After the smoke, a heated wire might be applied to a swollen gum or infected tonsil to finish the job. This was believed to prevent further infection, or as they put it, to drive out the corruption completely. The treatment probably did offer some benefits, since many of the herbs used, like sage and frankincense, have antibacterial properties. But the delivery method was crude, and without understanding dosage, patients might inhale too much, causing dizziness, vomiting, or even poisoning from certain plants. Today, mouth fumigation has been replaced by antiseptic mouthwash, antibiotics, and safe pain relief. The closest modern equivalent might be inhaling medicated steam for sinus problems, but without the risk of burning your tongue or passing out from smoke inhalation. So, next time you gargle with minty rinse, be grateful you're not holding your head over a brazier while someone blows burning sage smoke into your mouth and calls it a cure.
Bone rebreaking to reset. The room is quiet except for the sound of ragged breathing. A man sits with his arm twisted at a strange angle, the bone clearly healed wrong after a break. The healer steps forward, grips the limb firmly, and without a word, snaps it again. Bone rebreaking was a common practice in the ancient world, and it was exactly what it sounds like, deliberately breaking a bone that had healed incorrectly so it could be set again in the right position. It was excruciating, but sometimes it was the only way to save a person's ability to walk, work, or even use a limb at all. Here's how it worked. Once the healer determined that a bone had set wrong, leaving the limb bent, twisted, or unusable, they'd gather assistants to hold the patient still. There was no anesthesia, just maybe a strong drink or a leather strap to bite down on. Then came the moment of truth. The healer would apply sudden, powerful force, sometimes pulling, sometimes striking, to snap the bone at or near the original fracture site. The sound alone must have been horrifying, a sickening crack that echoed in the room. Once the bone was rebroken, it had to be set properly this time. The limb would be pulled straight, aligned carefully, and then immobilized with splints, wooden boards, or plaster-like materials made from clay or linen soaked in resin. The patient would be told to keep still for weeks, no easy task without crutches or proper casts. The pain didn't end after the procedure. The patient had to endure weeks of aching, throbbing, and swelling while the bones slowly knit back together. Infection was a constant risk if the skin had been broken, and there was always the chance the bone wouldn't heal right this second time either. Despite the brutality, this procedure sometimes worked remarkably well. Ancient physicians like Hippocrates wrote detailed guides on how to reset bones, including illustrations showing correct alignment. Some patients went on to regain nearly full function, proving that even without modern X-rays or surgical tools, these healers had a surprising understanding of anatomy. But the failures were just as memorable. A badly rebroken bone could leave a patient permanently disabled, or worse, could lead to blood loss or infection that killed them. Today, orthopedic surgeons sometimes rebreak bones, but under general anesthesia, with precise imaging to make sure everything is aligned perfectly. Patients get painkillers, sterile surgical environments, and physical therapy to help them recover. So next time you hear a bone snap in a sports game and cringe, remember, a few centuries ago, that sound might have been deliberate,
and the person screaming didn't have the luxury of numbing meds or a clean hospital bed afterward.
Spinal traction. Let the spine be stretched until the humors are released. That's an actual instruction from medieval medical texts describing spinal traction, a procedure where patients were tied to ropes and pulled in opposite directions until their back literally cracked. Spinal traction was used to treat back pain, spinal deformities, and even paralysis. The belief was that many problems came from a spine that was compressed or misaligned, and the way to fix it was to stretch the patient until the bones popped back into place. Here's how it worked. The patient would be laid flat on a wooden board or mat. Ropes were tied around the wrists and ankles, sometimes even the head. Assistants or a pulley system would then begin pulling, slowly at first, then harder, until the body was under significant tension. In some cases, the patient was suspended entirely, hanging from the ropes while gravity did the work. Other versions used a rack-like frame that allowed the practitioner to control the stretch more precisely. The goal was to create enough separation between the vertebrae to relieve pressure on nerves, straighten hunched posture, or reset the spine. The sensation must have been terrifying. Your joints and muscles would scream under the tension, and the cracking noises, which might have been normal joint cavitation, were taken as a sign that the treatment was working. Pain could be intense, but some patients reported immediate relief afterward, much like a good chiropractic adjustment today. Traction wasn't just for back pain. Some healers used it to treat sciatica, dislocated hips, or even to make people taller temporarily. In extreme cases, it was combined with heat therapy or massage, with the patient kept stretched for hours at a time. Of course, it could go wrong. Too much force risked dislocating joints, tearing muscles, or even breaking the spine. There are accounts of patients left permanently crippled after overzealous traction sessions. And there was a dark side, the infamous rack, a design to painfully stretch prisoners, was likely inspired by or adapted from early medical traction tools. Despite the risks, spinal traction survived for centuries, evolving into more sophisticated techniques. Even today, a gentler, much safer version exists. Traction tables and inversion therapy are still used by physical therapists to relieve pressure on the spine. So the next time you hear someone's back pop during a chiropractic visit, think about how their medieval ancestor might have been stretched on ropes until they heard the same sound and just hoped they'd be able to walk afterward.
Hot oil joint injections. Because nothing says healing like pouring boiling oil into your knee, right? As bizarre as it sounds, ancient and medieval healers really did this, and they believed it was one of the best ways to treat swollen, painful joints. Arthritis, gout, and joint infections were common and debilitating in the past. Without anti-inflammatory drugs, doctors tried just about anything to reduce swelling and pain. One of their more extreme solutions was to heat oil, usually olive oil or a mixture infused with herbs, until it was nearly boiling, then inject or pour it directly into or onto the joint.
The process wasn't subtle. The patient would be restrained or held down while the surgeon made a small incision over the joint to create an opening. Then, using a metal syringe or funnel, the hot oil was delivered straight into the space around the bone. The goal was to burn out the corrupt humor causing the pain and simultaneously sterilize the area. The pain must have been staggering. Imagine an already inflamed joint, hot, swollen, throbbing, and then adding scalding liquid into the mix. Patients often screamed or passed out during the procedure, which might have been a small mercy. Once the oil cooled, the area would be bandaged and left to heal. In theory, the burn would cauterize diseased tissue and stimulate new, healthier growth. In practice, it often caused more swelling, blistering, and tissue damage. And if the oil wasn't sterile, which it almost never was, infection could set in, turning a painful joint into a deadly one. Despite the risks, this practice persisted for centuries, particularly in battlefield medicine. Surgeons believed that hot oil could prevent gangrene after deep puncture wounds, so they used it liberally on soldiers. The French surgeon Ambroise Paré famously rejected this method in the 16th century after running out of oil during a battle and noticing that the untreated soldiers actually recovered better than the ones who had been burned. There's a certain grim logic to the idea. Heat does kill bacteria, and it might have helped sterilize wounds in some cases. But the collateral damage, severe burns, scar tissue, and crippling pain often outweighed the benefits. Today, joint injections still exist, but they involve anti-inflammatory steroids, numbing agents, and strict sterilization protocols. The only thing hot about them is maybe the compress they give you afterward. So next time your knees ache and you complain about a cortisone shot, just remember that your ancestors might have had a surgeon pouring boiling oil into their joint and calling it progress.
Dislocation treatment by jerking. A man grabs your arm, braces his foot against your chest, and yanks with all his strength. There's a loud pop, and suddenly your shoulder is back where it belongs. This was the standard treatment for joint dislocations in the ancient world, brute force. If a shoulder, elbow, hip, or knee came out of its socket, there were no x-rays, no anesthetics, and no surgical suites. The solution was to pull until the joint popped back in. The process was often dramatic. For a dislocated shoulder, the healer might have the patient lie flat while assistants held them down. Then, using hands, ropes, or even a stick as leverage, the joint was pulled and twisted until it snapped back into place. Sometimes the practitioner would use their foot or knee for extra force, pressing it against the patient's body as they pulled on the limb. The pain must have been off the charts. A dislocation is already excruciating, and the force needed to realign it would have sent a shock wave through the entire body. Patients sometimes screamed or fainted from the sudden pain, which, ironically, might have made the reset easier since unconscious muscles are easier to manipulate. Not all methods were gentle. Historical accounts describe healers suspending patients by the dislocated limb and letting gravity pull the joint back into place, or tying ropes to horses or oxen and letting the animals do the pulling. These more extreme methods were risky, but sometimes necessary if the joint was badly stuck. And of course, things could go wrong. Pull too hard and you could tear ligaments or break the bone entirely.
Pull in the wrong direction and you could damage nerves or blood vessels, leaving the patient permanently disabled. But when it worked, it must have been an incredible moment. 1 second, the joint is visibly deformed, the patient is writhing in agony, and the next, there's a pop and the limb is back where it belongs. Relief was immediate, even if the soreness lingered for weeks. Afterward, the joint was usually immobilized with splints, wraps, or slings, and the patient was told to rest. In some traditions, herbal poultices were applied to reduce swelling and speed recovery. Today, doctors still treat dislocations manually, but with anesthesia, imaging, and far more precision. Sedation helps relax the muscles so the reset can be done smoothly and safely. And instead of a farmer yanking on your arm, it's a trained orthopedic professional gently guiding the joint back into place. So the next time you see an athlete's shoulder pop out on live TV and get fixed on the sidelines, remember that the ancient version looked pretty much the same, just with fewer safety precautions and a lot more screaming.
Skull drilling for madness. The cure for insanity once involved drilling a hole in your skull, not as punishment, but as medicine. This procedure, known as trepanation, was used for thousands of years, not only for head injuries, but also for mental illness. Ancient and medieval healers believed madness, seizures, or possessions were caused by evil spirits or trapped humors inside the head. The solution? Give those spirits an escape route. The process was as grim as it sounds. The patient would be restrained, sometimes willingly, sometimes by force, and the surgeon would shave the head over the chosen spot. Using a sharp stone, knife, or early hand-powered drill, they would scrape or bore through the skull layer by layer until they reached the membrane that surrounds the brain. There was no anesthesia, just raw endurance. The sound of bone scraping away must have been terrifying, and the vibration would have reverberated through the entire skull. Some patients reportedly sang, prayed, or screamed during the procedure. Others fainted and were drilled while unconscious. Once the hole was complete, the belief was that the harmful spirit or bad air could finally leave the body. In some cases, healers even reported hearing a whistling sound as proof the escape had worked. Surprisingly, many patients survived. Archaeologists have found skulls with trepanation holes that show significant bone healing, meaning the patient lived for months or years after the procedure. Some skulls even have multiple holes, suggesting repeated treatments, either because the first attempt didn't work or as a form of ongoing maintenance. Did it actually help? In rare cases, yes, not for demons, but for real medical reasons. Drilling a hole in the skull can relieve pressure from brain swelling, which might have saved patients suffering from head trauma. But for mental illness, epilepsy, or psychosis, this was no cure. The patients may have appeared calmer afterward, possibly from shock, blood loss, or brain injury, which convinced the healers that the operation had succeeded. The risk was enormous. Infection, bleeding, and accidental injury to the brain could easily kill the patient. And yet, trepanation persisted
well into the Renaissance and even the 18th century as a last-ditch effort to treat madness. Today, neurosurgery still occasionally involves drilling into the skull, but with advanced imaging, sterile tools, anesthesia, and precision that our ancestors could never have imagined. And no one believes it's letting out evil spirits anymore. So the next time someone jokes about having a hole in their head, remember, for much of history, that was considered a legitimate prescription for mental illness.
Flogging as therapy. Yes, you read that right. There was a time when doctors literally prescribed whipping as a treatment for mental illness. Depression, hysteria, melancholy, even laziness were thought to be curable by a good, hard flogging. The logic behind this bizarre practice went like this. If a person was listless, unmotivated, or acting irrationally, then a strong physical stimulus would wake up their nervous system and restore balance. Pain, they believed, could shock the body and mind back into proper function, almost like rebooting a misbehaving computer, but with a lever strap. The process was exactly what you imagine. The patient would be restrained or ordered to strip down, then whipped across the back, buttocks, or legs. The number of lashes could range from a few symbolic strikes to dozens, leaving welts, bruises, and even open wounds. In some cases, the patient was expected to cry out or weep during the process. This was seen as part of the healing, a way to release pent-up emotions. If the patient didn't respond appropriately, the whipping might be repeated until they did. The treatment wasn't only physical, it was moral. Many doctors believed that mental illness was tied to weakness of character, idleness, or sin, and flogging was a way to punish the disorder out of the patient. This blurred the line between therapy and cruelty, a disturbing overlap that persisted for centuries. In monasteries and religious hospitals, flogging could be accompanied by prayers or confession, turning it into a ritual cleansing of both body and soul. Some records describe patients thanking their caretakers afterward, believing the pain had indeed driven out their sadness or sinful urges. Of course, this could also be traumatic. Being whipped, especially in front of others, was humiliating, painful, and sometimes life-threatening if infection set in afterward. For some patients, it likely worsened their mental state instead of helping it. And yet, there were cases where patients seemed to improve after a flogging. Modern historians think this might have been due to a mix of adrenaline, endorphins, and sheer fear temporarily overriding depressive symptoms. In other words, the pain distracted them, but it was hardly a cure. Today, flogging as therapy is thankfully a thing of the past, and mental health treatment focuses on compassion, understanding, and science-based methods like therapy and medication. But this strange chapter of history is a reminder of how often medicine confused punishment with healing, and how far we've come in realizing that pain isn't always the answer. So next time someone tells you to snap out of it when you're feeling low, be grateful they don't mean it literally, with the whip in hand.
Rotating chair therapy.
What if I told you that, for nearly a century, psychiatrists treated mental illness by spinning patients in a chair until they vomited? This wasn't a carnival ride. It was considered a serious medical procedure. Rotating chair therapy became popular in the late 18th and early 19th centuries thanks to physician Erasmus Darwin, yes, Charles Darwin's grandfather. He believed that many mental disorders were caused by irregular blood flow to the brain. The solution, in his view, was to redistribute that blood. And what better way to do that than by spinning patients like tops? The chair itself was often a specially designed contraption with straps to hold the patient securely by the chest, arms, and legs. Once strapped in, the patient would be rotated at increasing speed, sometimes gently at first, sometimes quickly right away, until they experienced dizziness, nausea, and eventually vomiting. This was supposed to reset the brain, almost like shaking up a snow globe so it could settle into a new, healthier pattern. Doctors believed that the spinning would not only improve circulation, but also shock patients out of mania, hysteria, or catatonia. The experience, as you can imagine, was far from pleasant. Patients reported extreme disorientation, panic, and violent sickness. Some passed out during the process, which doctors considered a good sign. Others came out of the chair too weak to stand. Their senses scrambled for hours afterward. And this wasn't a one-time treatment. Some patients were subjected to daily spinning sessions, enduring round after round of induced nausea and vertigo. Records show that the chair was used on everyone from melancholic patients to those considered violent or disruptive, since the weakness afterward made them easier to manage. In fairness, there were cases where the therapy seemed to calm agitated patients, likely because they were too exhausted to keep fighting. But in the long term, it did little to treat the underlying mental illness, and sometimes caused injury or even death if the spinning was too aggressive. Eventually, rotating chair therapy fell out of favor as more humane approaches to psychiatry developed. Doctors began to realize that traumatizing patients probably wasn't the best way to heal them, no matter how scientific it looked on paper. Today, the closest thing we have to this is vestibular therapy, gentle exercises designed to help with dizziness and balance problems. But no one is strapping patients down and spinning them until they throw up. So next time you get dizzy after standing up too fast, be glad you weren't born 200 years ago. Because if you had been, a doctor might have seen that as a great opportunity to spin you like a carnival ride, all in the name of medicine.
Isolation in darkness. The door closes, and suddenly there's nothing. No light, no sound, just darkness pressing in from every side. For some patients in the past, this wasn't punishment. This was a treatment. Isolation in complete darkness was once considered a way to heal both the body and the mind. Physicians believed that overstimulation, too much light, sound, or human contact could worsen certain illnesses, especially mental ones. The solution? Remove every possible stimulus until the patient was left with only themselves. The
Treatment usually took place in small windowless rooms, sometimes underground. The patient would be placed inside with only the barest necessities: a straw bed, maybe a chamber pot, and very little food or water. Once the door shut, they were left alone for hours, days, or even weeks at a time. The idea was that this sensory deprivation would calm the nervous system, quiet racing thoughts, and restore balance. Some doctors even claimed that darkness could draw out disease, the way a poultice draws out infection. But for many patients, the experience was terrifying. Being locked in pitch blackness could cause disorientation, hallucinations, and overwhelming anxiety. People reported hearing phantom voices, seeing flashes of light, or feeling as if the walls were closing in on them. In some cases, isolation was combined with fasting or bloodletting to purify the patient even further. The combination of hunger, weakness, and sensory deprivation often left them too exhausted to resist treatment, which some physicians took as a sign that it was working. While some patients may have come out calmer, simply relieved to see daylight again, others were left worse off, traumatized by the ordeal. Extended isolation could lead to long-lasting psychological damage, including paranoia and depression. And yet this practice persisted well into the 18th and 19th centuries. Early asylums often used isolation rooms for patients considered disruptive, both as a way to control them and as a supposed therapy. Today, we know that prolonged sensory deprivation can harm mental health rather than help it. Modern psychiatric care focuses on therapy, medication, and safe environments rather than locking patients away in the dark. Still, there's something unsettling about this chapter of medical history. The idea that healing was once thought to mean stripping a person of every connection to the outside world and leaving them alone with their thoughts. So the next time you turn off the lights and enjoy a moment of peace, remember that for some patients in the past, darkness wasn't a choice. It was their entire world, until someone finally decided they were well enough to open the door.
Freezing therapy. The patient is led outside into the winter air, shivering already. The attendants strip off their clothes and lay them down in the snow. There is no blanket, no fire, only the bitter wind and the crunch of frost underfoot. This is not punishment. This is medicine. For centuries, cold exposure was used as a way to shock the body back to health. Physicians believed that extreme cold could slow down fevers, calm mania, and even reset the mind in cases of hysteria or delirium. The colder the therapy, the better. The treatment could be as simple as placing the patient outside during winter nights, or as extreme as burying them up to the neck in snow. Some records describe pouring buckets of icy water over patients or dunking them in frozen rivers as part of the regimen. The goal wasn't just cooling, it was total shock. Doctors believed that the sudden drop in body temperature would jolt the nervous system, snap patients out of mental episodes, or force the heat to fever back inward. The experience was brutal.
Patients often screamed, struggled, or begged to be brought back inside, but attendants were told to keep them in place until the doctor was satisfied. The body would shake violently as it tried to stay warm, lips turning blue, teeth chattering uncontrollably. Sometimes this was combined with other harsh treatments. After freezing sessions, patients might be wrapped in blankets and placed near a fire to restore balance, only to be thrown back into the cold again later. The cycle could repeat for days. Results were mixed, to say the least. Some patients did recover from fevers or mental episodes, possibly because the body went into survival mode and reduced inflammation on its own. But others became dangerously hypothermic, slipping into unconsciousness or dying from exposure. In some cases, this therapy was applied to people with violent mania or delirium simply as a way to subdue them. After being half frozen, most patients are too weak to resist treatment or cause trouble, which might have been part of the point. Today, controlled cold therapy is still used in very specific medical contexts, like therapeutic hypothermia after cardiac arrest. But it's done with precision monitoring, not by tossing someone into a snowbank and hoping for the best. So the next time you complain about stepping outside on a chilly morning, remember there was once a time when doctors thought lying naked in the snow until you nearly froze was just what the doctor ordered.
Eye scraping for infection. Did you know that one of the oldest recorded eye treatments involved scraping the inside of your eyelid with a blade? Yes, that was considered cutting-edge ophthalmology in the ancient world. Eye diseases were incredibly common in early history, especially in hot, dusty regions where infections spread quickly. Conditions like trachoma cause the eyelid to swell, scar, and turn inward, making the eyelashes rub painfully against the eye. Left untreated, this could lead to blindness, so physicians had to get creative. Their solution was both brilliant and horrifying: eyelid scraping. The healer would first pull the infected eyelid outward, sometimes using a special hook or forceps. Then they'd take a sharp blade or small flat tool and literally scrape away the inflamed tissue from the inside of the lid. The procedure was often done with the patient fully conscious, sitting on a stool or lying on a mat. There were no numbing drops, no sterile gloves, just someone holding your head steady while a sharp object came dangerously close to your eyeball. The sensation must have been unbearable: burning, tearing, and a constant urge to blink against the pain. Once the scraping was complete, the eyelid might be cauterized with a heated probe to stop bleeding and prevent the lashes from turning inward again. Some physicians also applied medicinal salves, usually a mixture of honey, wine, and herbs, directly into the raw eyelid to speed healing and fight infection. It sounds brutal, but in some cases this saved the patient's vision. By removing scar tissue and correcting the position of the eyelid, the scraping prevented further damage to the cornea. Archaeologists have found references to this procedure in Egyptian papyri and Greco-Roman medical texts, suggesting it was a well-known and fairly standard treatment. Of course, there were risks. Infection could spread deeper into the eye, scarring could worsen, and a slip of the blade could blind the patient instantly. But for many, the alternative, slow, painful blindness, was even worse. Today, eye surgery is one of the most precise and carefully controlled fields of medicine, Conditions like trachoma are treated with antibiotics or delicate surgery under sterile conditions, often with lasers or microsurgical tools. And yes, the patient is comfortably numbed first. So the next time you get an eyelash stuck in your eye and complain about how annoying it is, just remember, a few thousand years ago, the fix for that irritation might have been someone scraping your eyelid with a knife and calling it good medicine.
Ear syringing with acidic liquids. Because what could possibly go wrong with pouring vinegar directly into your ear canal? In the ancient and medieval world, that was exactly the treatment for ear pain, infection, and even hearing loss. Earaches were a big deal before antibiotics. Infections could spread quickly, causing fevers, dizziness, and even death if they reached the brain. So healers did what they could with what they had, and that meant experimenting with every liquid they thought might dissolve the sickness. One of the most popular remedies was vinegar. Physicians would warm it up, sometimes mix it with garlic, onion juice, or herbs, and then carefully, or not so carefully, pour it into the ear using a small funnel or reed. The idea was to kill bacteria, soften wax, and draw out whatever was causing pain. The sensation must have been shocking. Even a few drops of vinegar in a paper cut burns. Imagine that in your ear against an inflamed eardrum. Patients reported stinging, sizzling sensations, and in some cases, temporary deafness afterward. And vinegar wasn't the only option. Ancient medical texts also mention using wine, urine, honey, or even melted lead, yes, really, as eardrops. Some healers believed that anything strong enough to cause pain was strong enough to chase away the disease. Of course, these treatments didn't always help, and sometimes made things worse. Strong acids could damage the delicate eardrum or cause chemical burns, leading to permanent hearing loss. If the infection had already spread, pouring liquid into the ear could push bacteria deeper, accelerating the problem instead of curing it. Still, there were occasional successes. Warm liquids might have provided temporary relief from pressure, and vinegar does have mild antibacterial properties. Patients who survived probably credited the treatment for their recovery, even if it was really their immune system doing the work. In some regions, this was done as a routine cleaning, not just for illness. People believed that flushing the ears regularly kept them healthy, so even those without pain sometimes had to endure an acidic rinse as a preventive measure. Today, ear syringing still exists, but it's done with sterile saline or warm water under controlled conditions. Acidic liquids are no longer used, and doctors strongly discourage putting random substances in your ears at home, especially vinegar, which can irritate the ear canal or damage the eardrum if used incorrectly. So the next time you use a few drops of ear cleaning solution or get a gentle irrigation at the doctor's office, just be glad you're not lying there while someone pours warm garlic vinegar into your ear.
Blinding for possession. There was a time when losing your sight was considered a cure, not a tragedy. In some parts of the ancient and medieval world, mental illness, seizures,
or erratic behavior were often blamed on demonic possession or curses. If prayers, fasting, or exorcisms didn't work, some healers and religious authorities resorted to extreme measures, partially blinding the patient to weaken the demon and force it to leave. The method varied, but it was always brutal. Sometimes hot metal rods were pressed to the corners of the eyes to damage vision without completely destroying the eye. Other times, sharp knives or needles were used to puncture or cut the cornea. In some regions, caustic herbs or powders were sprinkled directly into the eyes to cause scarring and blindness over time. The belief behind this horrifying practice was simple. The possessing spirit was thought to thrive on the senses. By robbing the patient of sight, the healer was cutting off the demon's ability to interact with the world. A blind or partially blinded person might appear calmer or less responsive, which was taken as proof the treatment was working. The pain would have been unbearable. The eyes are among the most sensitive organs in the body, and the searing heat or sharp punctures would have caused immediate agony, tearing, and swelling. Many patients likely fainted from the shock, which might have been interpreted as the demon leaving the body. Long-term effects were devastating. Even if the patient survived an infection, not guaranteed in a time without antiseptics, they were left permanently impaired. Some lost their sight completely. Others developed chronic eye pain, ulcers, or disfigurement. And yet, this was sometimes celebrated as a success. Families might claim their once possessed relative was now quiet, manageable, or cured. In reality, the person was simply too traumatized or disabled to behave as they had before. Not all instances of deliberate blinding were malicious. Some may have been well-intentioned attempts to treat what doctors didn't understand. But the line between treatment and punishment was thin. In some cases, blinding was also used on criminals, heretics, or people considered dangerous, mixing medicine with social control. Today, of course, such practices would be considered a human rights violation. Mental illness is treated with therapy, medication, and compassion, not with life-altering injuries. So, the next time someone calls modern psychiatry harsh, remember that centuries ago, the treatment plan for possession might have involved destroying your eyesight, all because someone thought it would scare a demon away.
Arsenic tonic doses. People once drank arsenic, yes, the same poison used in murder mysteries, as a health tonic. Arsenic was a popular medicine for centuries, prescribed for everything from poor digestion and fevers to fatigue and even beauty enhancement. Physicians believed that small doses of poison could toughen the body, building resistance to illness and making the patient stronger. These tonics often came in the form of powders, pills, or even sweetened drinks. Patients might take them daily, convinced they were purifying their blood or boosting their vitality. In some parts of Europe, especially in the 19th century, people even took arsenic to give their skin a pale, fashionable glow. The theory wasn't completely insane. In tiny doses, arsenic does have biological effects. It can increase blood flow, stimulate appetite, and create a feeling of warmth and energy. Some patients reported improved moods and a rush of strength after taking their dose, which made it seem like the treatment was working. But arsenic builds up in the body over time. and the line between tonic and toxic is very thin. Chronic users began to develop classic symptoms of arsenic poisoning: stomach pain, vomiting, diarrhea, numbness in the hands and feet, hair loss, and darkened skin. Some experienced tremors, confusion, and eventually organ failure. Still, the practice persisted. Doctors continued to prescribe arsenic compounds well into the 19th century, not just as tonics, but as treatments for conditions like asthma, psoriasis, and even syphilis. In fact, one of the first effective drugs for syphilis, salvarsan, was an arsenic-based compound. Arsenic tonics weren't just for the sick either. Some athletes and laborers took them to improve stamina, believing that a hardened constitution would help them work longer and recover faster. In Austria, there was even a group of so-called arsenic eaters who consumed the poison regularly as a kind of folk performance, boasting about how healthy it made them. Of course, many of these users didn't live long enough to pass on the habit. Arsenic is cumulative, meaning even small, repeated doses eventually become lethal. Symptoms could mimic natural diseases, so many arsenic deaths were likely misdiagnosed as stomach illnesses or wasting fevers. Today, we know arsenic is a potent carcinogen and neurotoxin. Modern medicine uses it only in very controlled ways, such as in certain chemotherapy drugs, and at doses carefully calculated to avoid killing the patient. So the next time you hear about a miracle tonic or health supplement promising to make you stronger, remember that not too long ago the miracle ingredient might have been straight up poison, and people were lining up for the daily dose.
Lead-based eye makeup. A healer leans over a patient with inflamed, swollen eyelid. Instead of reaching for an herbal salve, they open a small pot of black powder, mix it with oil, and smear it directly onto the wound, even into the cut itself. The powder? Lead-based coal. In the ancient world, lead wasn't just used for pipes and paint. It was part of medicine. Egyptian, Mesopotamian, and Greco-Roman physicians believed that lead compounds had powerful healing properties. Kohl eyeliner, which we usually think of as a beauty product, was often applied as a treatment for eye infections, styes, and injuries. The idea was that the mixture would disinfect the area and draw out pus or illness. In reality, it probably did help somewhat. The soot and other minerals in coal may have had mild antibacterial effects, but the lead content made it dangerous, especially when applied to open wounds. This was not a dainty cosmetic application. Physicians would press the mixture right into the inflamed area, rubbing it along the lid margins or even into small cuts made to help the infection drain. The stinging and pain must have been intense, but if the swelling reduced later, it was taken as proof that the treatment worked. Lead was also used in other medical ointments, not just for the eyes. Lead oxide, litharge, and white lead were ingredients in plasters and creams for ulcers, burns, and skin infections. But the eye was one of the most vulnerable places to put it. The thin skin and blood vessels around the eye made absorption into the body very easy. Over time, chronic use of lead-based treatments could cause systemic poisoning. Symptoms might include fatigue, stomach pain, headaches, and eventually neurological problems. Some historians even speculate that widespread lead exposure through medicine, makeup, and plumbing contributed to health crises in ancient Rome. Still, lead-based coal stuck around for centuries. In some cultures, it was applied to newborns' eyes as a protective charm against infection or the evil eye. This was done despite the risk because the practice was deeply ingrained as both a medical and spiritual safeguard. Today we know just how toxic lead is. Even tiny amounts can cause developmental problems, nerve damage, and blindness. Modern eyeliner and eye medications are carefully formulated without heavy metals, and no doctor would ever rub lead into an open wound. So the next time you see those striking black-lined eyes in Egyptian art, remember, that wasn't just fashion. For some, it was literal medicine, and one that came with a slow, poisonous price.
Snake venom therapy. What would possess someone to inject themselves with snake venom on purpose? Believe it or not, this wasn't a dare. It was once considered legitimate medicine. For centuries, healers and herbalists have experimented with tiny doses of venom from vipers, cobras, and other snakes as a way to stimulate the blood. The logic was simple. Venom caused dramatic reactions, swelling, heat, and increased circulation. So, in very small amounts, it might boost the body's natural healing processes. The practice started in ancient times. Some healers would deliberately allow a snake to bite a patient, then quickly cut or cauterize the wound to control how much venom entered the body. Others created primitive antidote mixtures that included dried venom, taken in small doses like medicine. These remedies were sometimes prescribed for arthritis, circulation problems, or even to strengthen someone thought to be frail. The patient experience was not gentle. Even in small amounts, venom could cause burning pain, redness, and swelling. Some people developed fever or nausea as their immune system reacted to the toxin. But when the pain faded and blood flow improved to the affected area, doctors took that as proof the treatment had worked. In some regions, snake venom therapy was also seen as a way to build resistance. People believed that taking small doses over time could inoculate them against deadly bites later, a belief that persisted well into the 19th and 20th centuries. There are even accounts of showmen and snake handlers who regularly dosed themselves with venom to demonstrate their supposed immunity. Of course, the margin for error was razor thin. Too much venom could lead to seizures, tissue death, or death by respiratory failure. Even a carefully measured dose could trigger a severe allergic reaction. And since ancient medicine had no way to measure precise amounts, many patients likely received far more than their bodies could handle. But surprisingly, there was some science hiding behind this dangerous idea. Snake venoms contain enzymes that affect blood clotting, nerve signals, and inflammation. Modern medicine has actually developed drugs based on these compounds, including medications that prevent blood clots or treat high blood pressure. The difference is that today, those compounds are purified, tested, and given in precise doses under controlled conditions. Back then, it was all trial and error, and the error could be fatal. So the next time you hear about alternative medicine that uses toxins or venoms, remember that this idea is thousands of years old. The difference now is that science has taken the danger out of it, so you don't have to risk a fatal snake bite just to get your blood moving.
Opium doping children. A baby cries through the night.
The exhausted mother, desperate for sleep, reaches for a small bottle labeled Godfrey's Cordial. A few drops on the tongue, and the crying stops. Not because the baby is calm, but because they've been drugged into silence. This was a common scene in the 18th and 19th centuries, when opium-based syrups and powders were sold as cures for colic, teething pain, coughs, and fussiness. These so-called soothing syrups contained potent doses of opium or morphine, enough to sedate even a screaming infant within minutes. At first, this must have seemed miraculous. Parents could finally get some rest, and the child appeared peaceful. But the peace came at a cost. Babies who were repeatedly dosed with opium often became lethargic, stopped eating, and wasted away. Overdoses were tragically common, with infants slipping into near-death states or dying outright. And it wasn't just at home. Workhouses and orphanages also used opium to keep large groups of children quiet for long hours. Dosing the children was seen as a practical way to manage them, especially in overcrowded institutions. The effects were grim. Children suffered stomach pain, slowed breathing, and sometimes convulsions as their tiny bodies struggled to handle the drug. Survivors often had stunted growth and developmental issues. For some, withdrawal was just as dangerous, sweating, tremors, and intense pain when the drug wore off. Even though these dangers were known, newspapers occasionally reported on soothing syrup deaths. The products stayed popular because they worked so effectively to silence crying. They were cheap, easy to get, and widely advertised as safe and wholesome. Some medical practitioners eventually began to speak out, warning that these syrups were too dangerous to be given without a doctor's supervision. By the late 19th and early 20th centuries, regulations were introduced requiring labeling of opium content, and safer alternatives like aspirin and acetaminophen gradually replaced them. Looking back, it's easy to judge, but many parents genuinely believed they were helping their children, or at least doing what they had to do to survive. In an era without pediatricians, modern pain relief, or sleep training, opium seemed like a miracle solution. Today, the idea of giving an infant a narcotic outside of a hospital setting is unthinkable. Modern medicine has strict rules about dosages, and any use of morphine for children is carefully monitored. So the next time you hear a baby crying and think, how did people deal with this in the past? The answer is grim. They didn't always deal with it safely. Sometimes they reached for a bottle that traded a few hours of quiet for a very real risk of tragedy.
Alcohol as anesthetic. Take a drink, you're going to need it. That wasn't a joke in the old days. It was actual pre-surgery advice. Before the discovery of anesthesia in the 19th century, surgery was an absolutely terrifying prospect. Patients were fully awake for amputations, tumor removals, and wound cleanings, unless they could drink themselves into unconsciousness first. Alcohol became the go-to anesthetic for centuries. The process was simple. Before the operation, the patient would be given wine, beer, or strong spirits, sometimes in massive quantities, until they were drunk enough to dull the pain, or ideally pass out. If the person stayed conscious, they'd at least be disoriented and easier to hold down while the surgeon worked. This was a risky strategy.
Alcohol lowers blood pressure and thins the blood, which meant patients often bled more during surgery. Too much alcohol could also cause vomiting mid-operation, which was dangerous if the patient inhaled it. And, of course, there was no guarantee that even the strongest spirits would completely knock someone out. Many patients still felt every cut. But when it worked, it made the surgeon's job much easier. A semi-conscious patient was less likely to thrash, and their cries might be muted enough that the procedure could be finished quickly. Alcohol wasn't just for patients either. Surgeons and assistants sometimes drank before surgery to steady their nerves. In battlefield settings, both doctor and patient might share from the same bottle before an amputation, turning the whole ordeal into something halfway between medicine and grim camaraderie. In some cases, alcohol was used alongside other crude sedatives like opium or herbal tinctures. But booze was cheap, widely available, and didn't require complicated preparation, making it the first choice in most situations. The downside was obvious. Drunkenness wasn't pain relief, it was just pain you couldn't fully process. Many patients later reported remembering the entire procedure, feeling every cut and burn, but being too weak to fight back. When ether and chloroform were introduced as true anesthetics in the 1800s, they revolutionized surgery overnight. For the first time, patients could be fully unconscious and still wake up afterward without the risks of alcohol poisoning. Surgeons could take their time and operate more carefully, and the success rate for surgeries improved dramatically. Today, alcohol is no longer used in operating rooms, at least not for patients. But the idea that a strong drink can help you cope with pain or fear lingers in popular culture, a holdover from those centuries when liquor was the only thing standing between you and agony. So the next time you hear someone say they need a drink before doing something scary, remember, a few hundred years ago, that drink might have been the only thing between them and a screaming, wide-awake amputation.
Maggot therapy is one of the oldest and strangest medical practices we know of. It was used to clean infected wounds by letting fly larvae eat away the dead tissue while leaving healthy flesh mostly untouched. This practice was recorded in many cultures, from ancient Mayan healers to Napoleonic battlefield surgeons. Doctors noticed that soldiers whose wounds were naturally infested with maggots often healed better than those without. The wounds were cleaner, smelled less, and were less likely to develop deadly infections. So rather than fight nature, some healers leaned into it. They deliberately placed larvae into a wound and then covered it to keep the maggots contained. Over the next few days, the larvae would feast, consuming dead tissue and pus. The patient might feel them squirming and wriggling, a skin-crawling sensation that must have been nearly unbearable. But by the time they were removed, the wound was cleaner and less inflamed. The smell, however, would have been overwhelming. Rotting tissue mixed with the stench of larvae waste was enough to clear a room. And the sight of a wound seething with movement could turn even a hardened stomach. Despite how gruesome it sounds, this treatment actually worked. Maggots secrete enzymes that break down dead tissue and even kill some bacteria. In an age before antibiotics, this could mean the difference between life and death,
especially for soldiers with deep, infected injuries. Still, there were risks. Maggots could escape containment, spread to healthy tissue, or attract flies that carried more disease. And not every patient could psychologically handle watching their wound turn into what looked like a living horror movie scene. Maggot therapy fell out of favor once antiseptics and antibiotics became available. But here's the twist. It's back. Modern medicine has reintroduced sterile, lab-raised maggots for very stubborn wounds that don't respond to other treatments. These days, they're contained in little mesh pouches so they can't wander, and the process is done in a controlled hospital setting. So while the idea of willingly letting something crawl inside your wound might still make your skin crawl, it's proof that sometimes the most disgusting solution is also the most effective.
Goat dung poultices. Because nothing says top-tier medical care like smearing goat poop on an open wound, right? Believe it or not, that's exactly what some ancient healers recommended. And yes, it went about as badly as you're imagining. Poultices, pastes or clumps of material applied to the skin, were a standard part of ancient medicine. People believed that certain substances could draw out infection, reduce swelling, or promote healing if left on the skin. And in rural communities where goats were plentiful, their dung became a readily available and free ingredient. The process was as simple as it was unsanitary. Fresh goat dung was mixed with water, honey, or herbs, then spread over the wound and covered with cloth. The theory was that the warmth and moisture of the poultice would suck out bad humors and speed recovery. Some texts even claimed that goat dung contained natural healing properties because goats were hardy animals. If it worked for them, why not for humans? The immediate effect might have seemed promising. The poultice kept the wound moist and covered, which does help with healing. But goat dung is teeming with bacteria, and applying it directly to a cut was basically an invitation for infection. Patients often developed swelling, fever, and pus-filled sores after a few days of treatment, which healers sometimes interpreted as a good sign, believing the body was expelling the sickness. In reality, the infection was getting worse, and many of these wounds likely turned gangrenous if not treated properly later. Despite the risks, dung poultices were surprisingly common in folk medicine all over the world, not just with goats, but with other animal feces as well. Cow dung, pig dung, and even bird droppings were used in various cultures for everything from wound care to skin treatments. Some of these applications did have mild benefits. For example, some animal manure contains ammonia that can act as an antiseptic. But the risk of tetanus, sepsis, and other infections was extremely high. Modern medicine has replaced goat dung with something a little less disgusting. Today, sterile dressings and antibiotic ointments keep wounds clean and moist without introducing dangerous bacteria. So the next time you get a small cut and reach for a bandage, just be grateful you're not being told to head to the barn first. Live animal organ therapy. Lay the warm liver of a freshly killed goat upon the swelling until the pain subsides.
That's not a joke. It's an actual line from early medical texts. For centuries, physicians believed that the fresh, warm organs of animals had healing power. The most common prescription was to take the liver, heart, or other organ from a recently slaughtered animal and press it directly onto a tumor, boil, or swollen area of the body. The logic was rooted in sympathetic magic and humoral theory. The life force, or vital heat, of the animal was thought to pass into the patient, restoring balance and driving out disease. Some doctors even specified which animals to use: goats or sheep for tumors, pigeons for infections, and sometimes newborn animals for maximum vitality. The process could be quite dramatic. The organ had to be used while still warm, meaning the animal was often killed on the spot, sometimes right in front of the patient. The healer would slice out the liver, rush it to the patient, and hold it against the diseased area until it cooled. Patients described the sensation as strange, warm, sticky, and slightly comforting at first, but it quickly became unpleasant as the organ cooled, bled, and began to smell. In some cases, the procedure was repeated with several fresh organs in succession, prolonging the ordeal. Of course, there was no real medical benefit to this other than the temporary heat, which may have soothed pain or increased blood flow. But there was also a significant risk of infection. Animal organs are far from sterile, and pressing raw tissue onto open sores was an easy way to introduce bacteria or parasites. Still, this practice was surprisingly widespread. Similar treatments appear in medical writings from ancient Greece, Rome, China, and the Middle East. Even as late as the 18th century, some physicians still recommended freshly slaughtered pigeons as a poultice for plague swellings, believing the bird would draw out the poison and sometimes even die in the process, proof, they thought, that the sickness had transferred. Today, of course, we know that tumors can't be cured by rubbing them with goat organs. Modern oncology relies on surgery, radiation, and targeted therapies, all done in sterile environments with no livestock involved. But the image of a healer rushing into a room with a dripping goat liver to press onto someone's chest is a haunting reminder of how far medicine has come. So the next time you hear someone talk about natural remedies, be glad that the definition no longer includes sacrificing a goat just to borrow its body heat for a few minutes.
Frog skin bandages. What do you do when you don't have sterile gauze, antibiotics, or even clean cloth? If you were an ancient healer, you might have gone to the nearest pond, caught a frog, skinned it, and wrapped its hide around the wound. Frog skin bandages were surprisingly common in early medicine. Healers believed that frog skin had special properties that could draw out infection, reduce swelling, and speed healing. In some regions, frogs were considered magically pure creatures because they lived both in water and on land, the perfect symbol of cleansing and renewal. The process was about as grim as it sounds. The frog would be killed, or sometimes used alive, skinned, and the soft, slippery hide was laid directly over the wound. Some healers even preferred the skin to be warm and fresh,
thinking the animal's vital heat would transfer to the patient. At first, this may have felt soothing. The skin was moist and cool, and it kept the wound covered, which does help healing. But there was a catch. Frog skin is not sterile. In fact, handling amphibians can expose you to all kinds of bacteria and parasites. Putting that directly on an open cut was a gamble. Some records suggest that frog skins were changed out regularly, replaced with fresh ones as the old ones dried or smelled. This meant the patient had to go through the process over and over again, sometimes for days, living with the constant smell of decaying animal tissue on their wound. And yet, it probably worked just enough of the time to keep the practice alive. Frog skin contains compounds with mild antibacterial and antifungal properties, a natural defense that helps frogs protect themselves in the wild. This might have reduced infection in some cases, giving healers the impression that the treatment was effective. Still, the risks were high. Unsanitary handling could make infections worse, and patients could develop fevers or sepsis from contaminated wounds. In some cases, the treatment probably killed more people than it saved. Even so, frog skin therapy persisted for centuries. In some folk medicine traditions, frogs were split open and tied to boils or swollen lymph nodes with the belief that the animal would absorb the illness. If the frog died quickly, that was taken as proof that the poison had been successfully drawn out. Today, modern medicine uses sterile bandages and antibiotics, no frogs required. Interestingly, scientists are still studying frog skin secretions for potential new antibiotics, proving there really was something to the idea, just not in the way ancient healers thought. So next time you put on a clean bandage, remember, there was a time when first aid meant a trip to the pond and a very unlucky frog.
Snakeskin tourniquets. The battlefield is chaos. A soldier clutches a gash on his leg, blood pouring out. There's no time for stitching or fancy bandages. The medic grabs a fresh snakeskin, wraps it tightly around the limb, and pulls until the bleeding slows. Yes, snakeskin tourniquets were a real thing. In the ancient world, healers used whatever was available to stop blood loss, and snakeskins were surprisingly popular. Tough, flexible, and easy to find, they made perfect makeshift ties when leather or cloth wasn't on hand. The process was simple. The skin of a snake, often dried or freshly removed, was wrapped around a wounded limb above the injury site. It was then twisted or knotted tight enough to cut off blood flow. This created pressure that slowed or stopped bleeding, giving the patient a better chance of survival. In some cases, this wasn't just first aid, but an actual treatment ritual. Some cultures believed the snake skin carried symbolic power, transferring the animal's strength and vitality to the injured person. Using the shed skin of a snake was sometimes considered even more potent, since the snake had renewed itself by leaving the skin behind. The downside? These tourniquets were often applied too tightly or left on too long. While they might save someone from bleeding out, they could also cut off circulation completely,
leading to tissue death and, ironically, the eventual need for amputation. And let's not forget cleanliness, or the lack of it. Snakeskins weren't washed or sterilized. They might carry dirt, bacteria, or parasites from the ground. Wrapping that directly against a wound was an easy way to introduce infection. Still, tourniquets in general were life-saving tools, and snakeskin was just one of many materials used. Leather straps, twisted vines, and strips of cloth were all common, but snakeskin had the advantage of being both strong and surprisingly stretchy. Some accounts even mention using the entire snake, gutted but still intact, as a living rope around the wound. Modern medicine has refined the idea into something much safer. Today's tourniquets are made of nylon and Velcro, applied with precise pressure to stop blood flow just enough to buy time for surgical repair. Soldiers, EMTs, and first responders are trained to use them properly so they don't cause more harm than good. But the image of someone tying a bloodied snakeskin around their leg is a stark reminder of how resourceful and desperate our ancestors were in the fight to survive. So the next time you see a shiny orange tourniquet in a first aid kit, remember, a few thousand years ago, your best option might have been whatever serpent happened to slither by.
Blood-boiling sweat hot. The air is thick, wet, and scorching. Your lungs feel like they're filling with fire, and sweat pours down your body faster than you can wipe it away. Around you, others sit silently, swaying, their faces flushed and eyes glazed. You're not in a spa. You're in an ancient sweat hut, and you're here until you nearly collapse. Sweat huts were used in many cultures around the world, from Native American sweat lodges to Finnish saunas to ancient Roman sudatoria. But while modern saunas are usually a short, relaxing visit, the historical version could be much more extreme, and in some cases, downright dangerous. The idea was simple. Heat the body until you sweat profusely, flushing out bad humors or toxins. Stones were heated in a fire, then doused with water to create steam. The hut was sealed to trap the heat, turning it into a suffocating chamber. Patients were expected to stay inside until they were drenched and weak, sometimes to the point of fainting. In some traditions, this was followed by sudden cold exposure, plunging into a river or rolling in snow to shock the system back to balance. This wasn't just a treatment for physical illness. Sweat huts were used to cure fevers, treat infections, prepare warriors for battle, or even cleanse the soul of bad spirits. Some were part of spiritual ceremonies that could last hours, with participants fasting, chanting, or praying while enduring the oppressive heat. The dangers were obvious. Extreme heat can quickly lead to dehydration, electrolyte imbalance, and heat stroke. In an enclosed hut, oxygen levels could drop, causing dizziness, confusion, or unconsciousness. Some participants never walked out. And yet, many people swore by the results. After surviving a session, patients often felt lighter, calmer, and pain-free, partly due to endorphins released during heat stress. For some, this was the first real relief they had experienced in days. Of course, the treatment could be overdone. Historical accounts describe patients who were kept in too long, emerging limp and delirious, or dying shortly afterward. But for many cultures, that risk was seen as worth it.
The ordeal itself was part of the healing. Suffering was a necessary step to be reborn into health. Today, sweat therapy still exists in safer forms. Spas, hot yoga studios, and infrared saunas let you sweat in a controlled environment with plenty of breaks and hydration. But the goal is relaxation, not near-death heat exposure. So the next time you step into a sauna and think it's a little too hot, remember, your ancestors might have sat there until they fainted, believing that only by pushing the body to its breaking point could true healing begin.
Ice bath shock. Your body hits the water and every muscle seizes. The river is so cold it feels like knives stabbing into your skin. You gasp, but the air is knocked out of you, and you're not allowed out yet. This is the treatment. For centuries, plunging feverish or delirious patients into near-freezing water was considered a legitimate way to reset the body. The theory was simple. Extreme heat from fever had to be countered with extreme cold. If you could shock the system hard enough, the fever would break. This treatment was used all over the world, from medieval Europe to 18th century hospitals, and it was not for the faint of heart. Patients were carried or dragged to icy rivers, ponds, or tubs filled with snow-melt water. If they resisted, attendants would force them in, holding them down until they were shivering violently. The experience was miserable and terrifying. A fever already leaves you weak, chilled, and disoriented. Being suddenly submerged in freezing water sent the body into full survival mode. Breathing became rapid and shallow, the heart raced, and muscles locked up. Some physicians recommended repeated dunkings. Pull the patient out, wrap them briefly, then throw them back in. The idea was to keep shocking the body until the fever dropped or the patient stopped struggling. Others used cold baths for mental illness, believing the cooling effect would calm agitation or mania. In rare cases, this might have worked. The cold could reduce inflammation and lower body temperature temporarily, offering some relief, but the risks were enormous. Prolonged exposure to icy water can cause hypothermia, heart arrhythmias, and even death, especially in someone already weakened by illness. Patients often emerged exhausted, teeth chattering, lips blue. Some collapsed unconscious as soon as they were removed, which healers sometimes interpreted as a good sign, believing the fever had finally released its grip. Cold water shock therapy persisted well into the 19th century, especially in asylums and hospitals. It wasn't just for fevers, it was also used to sedate patients considered violent or disruptive. A few minutes in an ice bath made almost anyone too weak to fight back. Today, cold exposure is used in medicine, but with precision. Therapeutic hypothermia is sometimes used to protect the brain after cardiac arrest, but it's done under careful monitoring in a hospital setting. Ice baths are also popular for athletes, but they're short, controlled, and voluntary, not forced on someone already at death's door. So next time you dip a toe in cold water and yelp about how freezing it feels, imagine being feverish, terrified, and shoved in head first, because that's what breaking a fever once meant.
Smoke inhalation cures. Ever been around a campfire too long and felt your lungs burn?
Now imagine doing that on purpose, because your doctor told you it would make you better. For centuries, breathing in smoke wasn't just a side effect of sitting near a fire. It was a prescribed medical treatment. Physicians believed that certain herbs, when burned, released healing vapors that could cleanse the lungs, cure coughs, and even drive out evil spirits causing illness. The process was straightforward, but far from pleasant. Patients were sat near a brazier or clay pot filled with smoldering herbs, sage, rosemary, garlic, frankincense, or even dried animal dung, depending on the culture. The patient was then instructed to inhale the thick smoke deeply, sometimes through a funnel or tube, to ensure they got a concentrated dose. The result was immediate coughing, watering eyes, and a burning throat. Some treatments required patients to continue breathing the smoke until they were lightheaded or nearly fainting. The healer might even cover the patient's head with a cloth to trap the smoke, creating a primitive version of a steam tent, but with smoke instead of steam. Smoke inhalation was used for all sorts of ailments: asthma, colds, tuberculosis, and even melancholy. Some cultures also used it as a ritual purification, believing the smoke carried away evil influences or spiritual impurities. There might have been a grain of truth behind it. Some of the herbs used did have mild antibacterial or anti-inflammatory properties. Breathing in warm vapor could also help loosen mucus, much like modern steam inhalation does. But the benefits were probably outweighed by the irritation to the lungs, especially for someone already sick. In some cases, the practice was downright dangerous. Thick smoke can reduce oxygen levels, and inhaling certain plants or animal dung smoke exposes the lungs to toxic chemicals. Patients might develop headaches, vomiting, or even long-term damage to the respiratory tract. Despite this, smoke inhalation treatments remained popular for centuries, appearing in medical texts from ancient Egypt, India, China, and medieval Europe. Even as late as the 19th century, doctors prescribed smoke fumigations for whooping cough and other lung diseases. Today, the closest thing we have to this is nebulizer therapy, or steam inhalation, except it's done with sterile saline or carefully measured medication, not random smoke from burning plants. And we now know that smoke inhalation is one of the worst things you can do to already inflamed lungs. So the next time you sit around a campfire and cough from the smoke, just remember there was a time when people paid good money to breathe that in on purpose, convinced it was the cure for everything that ailed them.
Deliberate blood infection. Sometimes the cure for infection was even more infection. In the days before germ theory, physicians believed that pus and swelling were signs the body was purging illness, proof that the bad humors were leaving through the wound. So if an injury was healing too cleanly, some healers would actually reopen it on purpose or deliberately introduce irritants to make it fester again. This practice was surprisingly common. The idea was that keeping a wound open and running would allow sickness to drain from the body, preventing it from going inward and causing fevers or death.
Surgeons would slice into half-healed injuries, squeeze out fluid, and sometimes rub in substances like dirt, animal hair, or herbs to restart the infection process. The patient experience was brutal. Imagine finally feeling relief from a painful injury, only to have it cut open again and deliberately inflamed. The pain would return full force, often worse than before. The wound would ooze, smell, and require constant bandaging, which was exactly what the doctor wanted. There was even a belief that certain kinds of good pus were necessary for proper healing. Medieval medical texts described laudable pus as a healthy sign, while bad pus was seen as a warning. Some healers prided themselves on their ability to produce the right kind of infection in a patient's wound. Of course, this was a dangerous game. Deliberately infecting wounds could lead to gangrene, sepsis, and death. Many patients likely succumbed to these complications, though healers may have blamed the strength of the poison rather than the treatment itself. And yet, sometimes this practice accidentally helped. By reopening a wound and draining pus, they were essentially performing an early form of abscess drainage, which can save a patient if done properly. The difference is that they didn't understand sterility, so reinfection was always a risk. This mindset lasted shockingly long. Even as late as the 19th century, some surgeons kept wounds open on purpose, believing that a flowing sore prevented deeper illness. It wasn't until antiseptic surgery and germ theory took hold that doctors realized cleanliness, not festering, was the key to survival. Today, wound care focuses on preventing infection entirely, keeping the area clean and allowing it to heal as quickly as possible. Abscesses are still drained, but under sterile conditions, and nobody is rubbing dirt into your injury to make sure it keeps oozing. So, the next time you see a scab and feel tempted to pick at it, remember that once upon a time, someone might have encouraged you to, because they thought more blood and pus meant better health.
Nasal drilling. You're lying on a wooden table, head pinned in place. A healer leans over you with a sharp, hand-powered drill. There's no anesthesia, no numbing, just the grinding sound as the tool bores through bone, right above your nose. This was nasal drilling, one of the earliest forms of sinus surgery. People have always suffered from chronic sinus infections, blocked nasal passages, and skull pressure from infections that wouldn't drain. Ancient physicians knew that trapped fluid in the head could be deadly. It could cause fevers, headaches, even death. So they devised a brutal solution: drill a hole to let it out. The procedure was straightforward, but nightmarish. Using a trephine, a kind of manual drill, or a sharpened bone tool, the surgeon would bore through the thin bone near the nose or above the eye socket until reaching the sinus cavity. The goal was to create an opening for pus or mucus to escape. The pain must have been indescribable. The face and skull are full of nerves, and drilling through bone would have sent shocks of agony radiating through the entire head. Patients often screamed, thrashed, or fainted mid-procedure, which might have actually made the rest of it easier for the surgeon to finish. Once the hole was complete, the healer might irrigate the cavity with wine, vinegar, or herbal mixtures to cleanse it. This would sting even more, but it may have helped kill some bacteria and reduce infection temporarily. The hole was often left open for days or weeks, packed with cloth to keep it from closing too soon. As horrific as it sounds, this treatment occasionally saved lives. Relieving the pressure from a sinus abscess could prevent the infection from spreading to the brain, something that was almost always fatal in that era. Archaeological evidence shows that some patients survived and lived for years with the drainage hole still partially open. But the risks were massive. A slip of the drill could damage the eye socket or pierce into the brain, causing instant death. Even if the procedure went well, infection could set in through the open hole, undoing any benefit. Nasal drilling persisted for centuries in various forms, slowly evolving into more precise surgical techniques. By the Renaissance, surgeons had refined the procedure to be less invasive, but pain relief was still minimal. Today, sinus surgery is done under anesthesia, with cameras and delicate instruments that can navigate through the nasal passages without drilling through the skull. Patients usually go home the same day, with far less trauma and far less screaming. So, the next time you complain about a sinus infection, remember, a few hundred years ago, the cure involved someone literally boring into your skull and hoping for the best.